Good morning, everyone. Welcome to the Will County Board meeting for May 19th, 2022. Can our members please take their seats? I will call this meeting to order. Board Member Balich, will you please lead us in the Pledge of Allegiance and introduce the clergy?
Of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. I'd like to call Minister Silvano Garcia from Cherry Hill Church to come and do the invocation.
May the grace and favor of our Heavenly Father be upon all of you today as you make your decisions on very important issues. And grace and peace to all of you that are here witnessing this. Will you join me in prayer? Our gracious Holy Father in heaven, we come before you, Father, thanking you for your kindness and goodness upon each and every one of us. Father, it is a blessing to know that the government of Will County welcomes you, Father. And I'm here to invoke your presence upon them, Father. Lord God, times are very difficult for many in this country. People are at odds with each other. There's so much division and chaos, and we know that among the sins that you hate, division is one of them. And I pray, O Holy Father, that you would bestow peace and grace upon all here today. We pray, O Lord, that you bless each of these board members, Father, that are governing this county of people, Lord, that you would bestow wisdom upon each and every one of them and discernment, Father, as they make decisions to approve and disapprove things, Lord. But we pray more than anything, Holy Father, that you would touch their hearts and minds in such a manner, Father, that they would set aside their personal and private agendas, that they would open their minds and hearts toward the people of this county, and that, Father, all that they do today and every day as they govern, that they would always remember the citizenry of Will County. Father, bless them with the great responsibility that they have in this community. Father, they were chosen by people of this community in voting. And Lord, many of them may be up for re-election. And we pray, Lord, that you be upon each and every one of them in their campaigns. And Father, we pray for your will be done. For you still are the one that raises up kings and you set them down, Father. And Lord, we just pray that your mighty hand be upon everyone here. Father, with the wars and chaos and lawlessness that seem to abound in this world, we realize, Father, that it's coming to our doorsteps as well, Father. So many killings, shootings in this county and in neighboring Cook County, Father, that are unnecessary. And Father, we just pray that your presence would be ever so stronger and brighter among your children in our community, Father. Lord God, have mercy upon all of us. And Lord, I just want to ask you to keep your angels around all of the first responders, the fire department. Bless the police officers of this county, and those who lead, Father. Lord, keep your angels around everyone here in this community, Father, and protect us all. And Father, I just pray that, again, all of these board members today would seriously consider the well-being of the citizenry of Will County. Father, it is difficult and getting more difficult for people since I've moved here, and I've listened to the people speak, from the poor to the middle class and even to the affluent, Father. And all I hear is complaints about high taxes, unwise spending. And Father, I know that a lot of folks say ministers are supposed to stay out of politics. And Father God, here they call me to be in their presence. And Lord, I just pray as I'm here standing before them and you, Holy Father, that they would listen and understand that cutting taxes is a good thing for the people of this county. Curbing spending is a good thing for this county and its people. Father, the poor can no longer afford to live here. So many people call me for money that they need for gasoline. And we live in the land of plenty. And as our grocery shelves are becoming empty, and there's not even enough formula for the babies, Lord. And we just pray, Father, that we would check our spending as a government and that we would seriously consider lowering the taxes upon the people here, Father. People, good, hardworking people that own their homes should not be having to pay a second mortgage that is called taxes, oh Lord. I pray, Holy Father, that you touch the hearts of these good men and good women that govern in this community, and that, Father, you give them boldness and courage and the wherewithal, Father, to do what is right before you and before the people whom they govern. Father, we ask this prayer humbly. Father, in Jesus' name, amen. God bless you all.
Madam Clerk, please call the roll.
Mueller. Frizzalone. Newquist. Ogala. Cook. Mustis. Mitchell. Tyson. Gazamfer. Trainier. Fritz. Gould. Van Dyne. Balich. Balich. Brooks. Winfrey. Parker. Ventura. Coleman. Markham. Berkowitz. Pretzel. Weigel. Freeman. Krolitis. Cowan.
24 present, 2 absent.
With 24 members present, we have a quorum. I need a motion to place on file the certificate of publication. A motion by Newquist, seconded by Cook. Madam Clerk, please call the roll.
Mueller. Frizzalone. Newquist. Ogala. Cook. Mustis. Mitchell. Tyson. Gazamfer. Trainier. Gould. Van Dyne. Balich. Brooks. Parker. Ventura. Coleman. Markham. Berkowitz. Pretzel. Weigel. Freeman. Krolitis. Cowan.
24 affirmative.
24 affirmative, the motion carries. I need a motion to approve the meeting minutes for the April 21st, 2022 board meeting. Motion by Tyson, seconded by Freeman. The previous roll call by Markham, seconded by Van Dyne. All in favor? Aye. Any opposed? The motion carries. Madam Clerk, will you please acknowledge the elected officials and media present today?
Today we have County Executive Jennifer Bertino Tarrant, County Clerk Lawrence Daly Ferry, Coroner Lori Summers, Auditor Duffy Blackburn, Recorder of Deeds Karen Stukel, Treasurer Tim Brophy, and for the media we have Alex Ortiz from the Herald News.
Thank you. I'm going to move on to resolutions and proclamation. Today we have a presentation by PACE. I'd like to invite Melinda Metzger and Rick Kwasdeski from PACE to join me at the podium for a few words and a check presentation. And Mayor Claire.
Oh, okay, great. Thank you very much for having us here today. I hope all of you remember back in October, I think we were here for our budget presentation and talked a little bit about some of the things that we were going to try to do and move forward with. And one of them was to get you guys $200,000 to assist you with your paratransit study that you guys had talked about doing. So we're here today to deliver that check. Also, by the way, we did have our first electric bus out front. I don't know if you guys seen that. It was kind of exciting, and we're very excited about that. We've got 20 more coming in at the beginning of next year, so you'll start to see those circulating a bit. Also out front was one of our 28-foot buses, new buses that will be going into service in Will County with our contractor as well. So on behalf of myself, Roger Clare, the Will County representative on the PACE board, and Melinda and our entire board, we'd like to present you guys with your $200,000 check to help you with that paratransit study.
I don't know if I want to take a check from you. Let's go over here and stand.
Yeah, sure. Yeah, no big cardboard check, a real one. Thank you.
Thanks, Rick.
Thanks, good to see you. Give it to Tim.
Yeah.
Yes, Margaret.
I would like to know how long is the bus going to be sitting outside? I would like to view it.
The electric bus, I think, is gone.
Oh, you released it already?
Yeah.
It's gone, but we can bring it back to another board meeting before another board meeting.
Okay, great.
Yeah, it was out there since 8:30, so. Yeah.
At this time, I'm going to invite Board Member Parker up to read the proclamation recognizing May as National Preservation Month, or you can read from your desk if you like. You're absolutely fine.
All right, thank you. I'd like to read this proclamation recognizing Historic Preservation Month. Whereas local historic preservation is an effective tool for revitalizing communities, fostering local pride, and maintaining historic character while enhancing livability. And whereas historic preservation is relevant for all communities, whether urban, suburban, or rural, and for Americans of all ages, all walks of life, and all ethnic backgrounds. And whereas it is important to celebrate the role of history in our lives and the contributions made by dedicated individuals in helping to preserve the tangible aspects of the heritage that has shaped us as a people. And whereas the National Trust for Historic Preservation first established National Preservation Week in 1973, and National Preservation Month has been recognized during the month of May and the years since. And whereas historic preservation is supported by the Will County Historic Preservation Commission, the Illinois State Historic Preservation Office, the Will County Historical Society, and local historical societies throughout the county. And whereas Will County has demonstrated its commitment to preservation as it grows and develops through historic structures, surveys, the future updated historic preservation plan, and by the nomination of significant cultural resources as Will County landmarks. And whereas 2022 marks the 30th anniversary of the Will County Historic Preservation Commission, now therefore be it resolved that the Will County Board and the Will County Executive do hereby recognize May as National Preservation Month and call upon the people of Will County to join their fellow citizens across the United States in recognizing and participating in the special observance. Dated this 19th day of May, 2022, by Jennifer Bertino Tarrant, Will County Executive, and Lauren Staley Ferry, Will County Clerk, and I do so move.
Motion by Parker, second by Krolitis. Previous roll call by Frizzalone, seconded by Coleman. All in favor? Any opposed? The motion carries. This time, I'm going to invite Board Member Ventura to read the proclamation recognizing Mental Health Awareness Month, and she's going to be joined by Tina Mackey, the president of NAMI, and Terry King to accept the proclamation.
You want me to do this afterwards? Or are you going to do it? Okay. Whereas mental health is essential to everyone's overall health and well-being, and whereas mental illness is real and prevalent, half of us have a mental health diagnosis at some point in our lives. And whereas before the pandemic, millions of Americans were experiencing stress, trauma, anxiety, and depression, the COVID-19 pandemic elevated these conditions, creating an unprecedented mental health crisis across our country. And whereas all Americans should feel comfortable in seeking help and support to manage, and whereas engaging in prevention, early identification, and early intervention are effective ways to reduce the burden of mental illnesses. And whereas NAMI Will Grundy joins the national movement to raise awareness about mental health, fight stigma, provide support, educate the public, and advocate for policies that support people with mental illness and their families. Now, therefore, be it resolved, the Will County Board and the Will County Executive hereby recognize May as Mental Health Awareness Month. But be it further resolved, the Will County Board and the Will County Executive call upon citizens, government agencies, private businesses, nonprofit organizations, and other groups to join in activities and take action to strengthen the mental health of our county. Dated this 19th day of May 2022, signed by Jennifer Bertino-Tarrant, Will County Executive, and attested to by Lauren Staley Ferry, Will County Clerk. Did you guys want to say something? Sure.
Oh, hold on, we got to make a motion first. So motion by Ventura, seconded by Ogala. Previous roll call by Mitchell, second by Cowan, sorry. All in favor? Any opposed? Motion carries.
Okay, all right, thank you. Good morning. Thank you. We're very appreciative of the proclamation and the acknowledgement of our services. The diagnosis of mental illness often occurs after years of struggle. We know that the average time between emerging signs and symptoms of mental illness and an efficient, effective treatment plan is often 10 years. 10 years. The stigma of mental illness is still so pervasive in our communities that people often resist reaching out, and even families who are eager to support their loved one sometimes feel like they're not able to reach out for support. At NAMI Will Grundy, we educate in order to reduce that stigma. We advocate to seek better services and improve services for individuals and their families, and we provide peer support groups for individuals diagnosed with a mental illness and their families. We're a volunteer organization, and there are no fees or charges for our services. So again, we're very grateful for the proclamation. We're glad to be here today. We've provided you with a brochure with some of our information, and there's a website there with more information. So again, thank you very much for having us here this morning.
At this time, Leader Mueller, will you please read the proclamation recognizing June as National Pride Month?
Thank you. Recognizing June as LGBTQIA+ Pride Month. Whereas the lesbian, gay, bisexual, transgender, queer, and/or questioning intersex ACE+ community is an integral part of Will County. We are business owners, teachers, parents, students, friends, and neighbors. Some of us live our lives effectively out in the county, and others do not out of fear of discrimination. And whereas the diverse makeup of the LGBTQIA+ community shapes and impacts the academic, social, and economic foundations of our county, and whereas the intersectionality of the LGBTQIA+ community allows for us to see things from multiple lenses to further the equity initiative for Will County. And whereas the LGBTQIA community has only been able to legally marry in Illinois since 2014 and federally as of 2015, that came with much resistance, and there are still places trying to reverse these decisions. And whereas the Stonewall riots occurred in June 28, 1969, a mere 53 years ago, paving the fight for LGBTQIA equality and visibility. Whereas Will County Pride Coalition and the pride groups of Will County are recognized as part of the Will County community and acknowledged for their continued work to advocate for equality for all. Now, therefore, be it resolved that the Will County Board and the Will County Executive hereby proclaim June as Pride Month in support of the LGBTQIA+ community. Be it further resolved that the Will County Board and the Will County Executive encourage all communities to take action and engage in dialogue to strengthen alliances, build acceptance, and advance equal rights. Dated this 19th day of May, signed Jennifer Bertino Tarrant and attested by Lauren Staley Ferry, Will County Clerk. And I so move.
Motion by Mueller, I heard a second by Trinier, previous roll call by Ventura, seconded by Freeman. All in favor?
Aye.
Any opposed? Motion carries.
Thank you.
Thank you. I'm now asking if we have any public comment for today's agenda items. We will have a public comment for our zoning cases, but if there are any general public comments for today's agenda items. You're not the. Okay, we're moving on. So all resolutions and ordinance from the April 21st, 2022 board meeting have been signed and returned. There is no new business. So at this time, I'm going to turn it over to Tyler Markham, Chairman of Land Use.
Good morning, everybody. I'd like to begin our Land Use and Development Committee by making the motion to open the public hearing for all land use cases. I so move.
Motion by Markham, seconded by Freeman. Madam Clerk, please call the roll.
Mueller. Frizzalone. Newquist. Ogalla. Cook. Mustis. Mitchell. Tyson. Gazanfer. Trainier. Gould. Van Dyne. Balich. Brooks. Parker. Ventura. Coleman. Markham. Berkowitz. Pretzel. Weigel. Freeman. Krolitis. Cowan.
24 affirmative.
24 affirmative. We are now in public hearing. Please be advised, absolutely no new evidence or information will be allowed once this land use public hearing is closed. We have several sheets of public comment, so I'm going to ask that you stay on task and focused. If it does get too lengthy, I will ask you to wrap it up if we seem to be redundant. So I'm going to start with ZC case 21-107. It looks like Thomas DiLorenzo. And if you're just here for comment, if you're just here, are you ready? You can speak. Yeah, thank you. Sometimes people just sign it and they just want to sign that they're here, so you could just let us know that you're not speaking. Just state your name again before you begin.
Tomas DiLorenzo. I live on the property that is in question. The pigs mentioned in the document are my pigs. Just here to support my case and answer any questions that anyone would have regarding any concerns they may have about the pigs.
Next, we'll move on to case ZC 22-008. Alondra Barrios. No, you're just here for, okay. Adrian Guzman. Just here it is. Okay. All right. All right, so the rehab of ZC 21106. Paul Hemper. No, okay. Brian Beedman. Just, okay. Tom Moore. If you're here to speak to, you can kind of start walking up too if you're one of the speakers. But I just want to make sure we get everybody. Stephen Bartolone. Okay. You gonna speak? No. Yeah, if you're gonna speak, just you can come on down. Oh, okay. Well, let's. Okay, so right now, if you are here to talk about the rehab facility, sorry, some of the zoning cases have been, people signed in on the wrong zoning cases. So if you're going to speak on the rehab facility, there's Mitch over there. He'll kind of line you up along the wall. So the podium, the mic is on the podium, so just state your name and proceed.
Thank you. My name is Lynn Ingram, resident of Elwood. I did send this as an email, but once I found out that I could actually come and speak in front of you, I decided you needed to see my face, not just my words. So I'm here today asking for your support of and your approval of the building of the rehabilitation facility project by Dr. Bipin Sharma and ECS, Existential Counseling Society. I ask for your approval today from two perspectives. The first and the most important is as a mom of an adult son who successfully went through the program at ECS. Sparing you a lot of the details, my son struggled for years with drugs and alcohol. It was a call in the middle of the night from yet another jail and hearing the words, "Mom, I need help. I can't do this anymore." That sparked joy and fear at the same time. I initially didn't know where to turn. It was a Sunday. Then I recalled that I had actually met Dr. Sharma at a networking group event, and I still had his number in my cell phone. So I texted him. Again, it was a Sunday. He responded immediately and said, "Call me." I explained the situation, and 2 days later, my son was at the facility moving in. Over 2 years later, he remains clean and sober. He has a career that he loves, and he's thriving in a new space. For a long time after completing the program, he still returned for their alumni group that meets to support existing residents as well as continuing his own journey of healing. Having the services of ECS right here in Will County, literally, I believe, saved his life. I can't help but wonder how many other moms throughout Will County would be able to recount the same kind of story if there was another facility like the one that my son was able to go to. ECS works, I believe, because it's small and it's personal. They aren't interested in a large institutional setting where people are just cranked in and out through a revolving door where you leave your cash as you go. I saw firsthand they genuinely build relationships, not just with the guys, but with the families too. I couldn't be more grateful for their care, their concern, and their treatment. The second reason I ask for your approval today is because of the basic need in Will County. There is an epidemic of addiction that's facing everyone in this county right now. Coming out of COVID makes it especially high. Are there other facilities? Yes. Are there other facilities like ECS? No. Are there enough facilities offering inpatient care with a proven program like ECS? Again, I say no. The need for this project to go forward is vitally important to everyone in this county. Even if you don't have a family member that's addicted, it affects you. We all know that addiction drives so many other things that touch everyone here. Crime of all varieties, law enforcement, jail overcrowding, court systems, healthcare, and I could just keep going on the list. The thing that sets ECS apart from other facilities treating addictions is that they're small. That's the upside and the downside. The upside, because they're successful with that model. The downside to being small is they fill up, and there simply isn't enough room for more guys who need to be able to come. That brings us here today to the vital need for your yes. The vote moving forward on this will change lives. We need these facilities so that services are available when someone else cries out in the middle of the night. I need help. I can't do this anymore. I humbly ask you to please be the reason they have somewhere to go. Thank you.
Thank you. Come on.
Hi, I'm Dr. Tony DeJoseph. I'm the regional CEO for 3 psychiatric hospitals in Illinois. One of them here in Will County, Silver Oaks Behavioral Hospital in New Lenox. I'm also a licensed psychologist in Illinois for the past 30 years, and I'm here to express my very strong support for Existential Counselor Society's rehabilitation program. My organization has extensive direct experience working collaboratively with ECS and referring clients to them for rehab. Having been in hospital behavioral health and all other levels of psychiatric care for the past 46 years, I can tell you, based on these years of experience, that ECS, without a doubt in my mind, is one of the highest quality treatment centers that Illinois has had. I have visited them personally. I have knowledge of their treatment model and philosophy, and I find it to be superior to most of the treatment that we have in Illinois. They house themselves in very attractive facilities. They have a very well-controlled clinical environment and no incidents of any trouble that could concern the citizens of Will County whatsoever. I have found also that my colleagues all over Chicagoland really universally hold them in high regard, and they've earned that reputation with all of us. With regard to need, it's unequivocal that there's not enough treatment available to match the magnitude of the problem, certainly in Illinois, nationwide for that matter. Let me frame this locally a bit. The opioid crisis certainly rages on in Illinois. Last measured by the state, there were 2,944 drug-related deaths in 2020, which was a 30% increase from 2019. So it's going in the wrong direction, and it still seems to be. Some of the other measures in the last couple of years shows that, or certainly, by the way, alcoholism certainly remains a serious problem everywhere as well. It's not only the opiates. Controlled prescription drug use and abuse, as well as heroin availability, remain as high as ever, stable and not going down. More locally, Will County EMS has the second highest number of naloxone runs among the 102 counties in the state of Illinois. Will County also has the 4th highest number of opioid-related emergency department visits in the state and the 4th largest number of opioid-related hospitalizations of the 102 counties in Illinois. So you can see that we have a pretty strong need here. We need more residential treatment in Illinois. The lack of beds has been a deficit for as long as I can remember in the field. We are not winning the war against the opiate epidemic, as we are not doing enough. Adding treatment centers as the one proposed is a definite piece of the solution that you have before you. Let me make another point that ECS has already proven their clinical quality and integrity and demonstrated their sincere mission to help individuals recover from the illness of addiction. And the story that the last speaker told is not an unusual one. A lot of people have that feeling about the great care they got at ECS. Considering the magnitude of the problem in Will County itself, I think we need all that ECS can give us in the way of treatment. Please grant the zoning amendment that will allow them to operate their residential treatment center. Thank you.
Good morning, board members. I'm Dr. Vicki Abenante. I'm a longtime resident of Will County. I taught and supervised special education programs for 30 years and currently teach education students at the university level. I volunteer as the School Safety Program Coordinator for Will County Emergency Management Agency. I've undoubtedly helped many people during my career. Unfortunately, the one person I could not help was my son. When my boys were 12 and 7, my husband died by suicide. That was extremely difficult for all three of us, as you can imagine. It was really tough for my older son. He eventually went to Virginia Military Institute for college. Military academies can be especially anxiety-producing. My son was dealing with acute anxiety, so the school sent him to a psychiatrist who put him on Xanax. The following 15 years of the lives of my entire family would become a nightmare. My son became addicted to Xanax and alcohol. He was unable to finish college or hold down a job. His family and friends were at a total loss and could not help him. As a parent, all I wanted for him was to get help, kick the addiction, and become a contributing member of society. This disease of addiction does not discriminate. People from all walks of life can have issues with substance abuse. It is indifferent to your race, socioeconomic status, age, religious beliefs, and educational background. As I can attest, it affects families in terrible ways. My son attended several drug rehabilitation facilities and saw many doctors. That's when he could find one available to him. His life was out of control, and I was sure I would lose him. I was sure the drugs and alcohol would kill him. If you are a parent and you know losing your child is the worst nightmare you can think of, it wasn't until he attended existential counseling services in Joliet that he finally got the help he needed. ECS's first facility had recently opened, and they had a bed available. This was the first facility that actually met his needs. Not only did they deal with his drug and alcohol use, but through counseling, they were able to get to the bottom of his past issues. I'm happy to tell you that he has been sober for almost 5 years. He is happy and healthy, a journeyman carpenter, married, and lives in Will County. Let me rephrase that. I'm not just happy, I'm over the moon. And I'm able to own my own life goals. As his mother, I can't tell you how extraordinary all of our lives are. Existential counseling truly saved my son. I recently learned that Existential Counseling Services is trying to open a third facility. All I can think about are the mothers who may indeed lose their sons if they don't have my son's opportunities. Please do not let this happen. Please approve the third facility for Existential Counseling Services and promote family healing in Will County. Thank you.
My name's Justin Abenante. I'm her son. Thank you. I can't believe that we're actually here having to debate this, because to me it seems like I just can't understand. It seems like a done deal. Why wouldn't anybody want to have a facility with more beds to help people? I just can't understand why you would deny that. It's beyond me. But I wrote down a quick letter for you all, and I'm just going to "4 years and 7 months and 23 days ago, I arrived at Existential Counselor Society. I was lucky enough to still have 1 month of insurance coverage left. When I say lucky, I mean lucky because I had lost everything. everything and everyone in my life. Everyone that loved me had given more than most of them should have or could have, in hopes that I might be able to get well. The hospitals in the area, they had given up on me. Every single one of them had given up on me. Even though I had insurance, they wouldn't let me in because they said there was nothing that they could do for me. Take that in. Think about that for a second. There's nothing we can do for you. There's nothing we can do for you. There's no place for you here. Even though I had insurance, they deemed me a lost cause and would not give me a bed. I had to go all the way to Des Plaines Central Behavioral Hospital. I spent 10 days there, and a social worker got me a bed at ECS. It was a place close to home. They got me a bed close to home where my family was, where my support system was. And I said, that's amazing. I didn't even know about this place. 2 weeks. I went to ECS because it was close to my family, my support system, and I sure am glad that I did. 2 weeks into my treatment, my insurance company decided that they weren't going to pay anymore because they said I didn't need that level of care. I don't know how they came up with that idea, but excuse me. Dr. Sharma, he informed me of this, and while I fought to get them to pay, he assured me that he would let me stay until I was ready to begin the next part of my journey. My insurance coverage lapsed 4 days after I left ECS. 4 days. It took me 8 months to regain my insurance eligibility through my work. And during that time, Doc saw me every single week for an hour or two. Every single week, he saw me and we talked. He didn't charge me a dime during those 8 months. Not a dime, because I didn't have any money. I have money now, but I didn't have money then, all right? I couldn't rub two nickels together. The process of recovery, it's a long one, and it's a slow one. And there's nobody out there that's willing to help you unless they get paid, but Doc was. ECS, the guys at ECS, they were willing to help me. They supported me and got me through the hard parts. They saved my life. He let me bring my then girlfriend in and even spend some time helping me mend the relationships with other members of my family. He gave me his personal number and made himself available to talk at any time should I need him. So let me explain this to you. There's a lot of cravings that go on when you're trying to kick drugs and alcohol. There's a lot of 2 a.m. mornings where you can't fall asleep, where your skin's crawling, where your body doesn't want to control itself, the physical things that you don't really understand unless you've been through what I've been through. And there's always that thing in the back of your mind, and it says, hey, you just go out and get a drink or just go out and get some drugs. You'll feel better. So he gave me his number, and he said, call me anytime. And I did. I called him at 2 a.m. I called him at 3 a.m. Sometimes I called him at 4 a.m. I just can't sleep, Doc. He was there for me. That saved my life. We started an alumni group about a year after I was sober, about a year. We started an alumni group that's based out of the rehab facility. And that alumni group, it's still there today. It provides recovering addicts with another layer of support for those in the early stages of recovery. What people don't realize is that recovery is a process. All right, it doesn't just happen one day. It takes a lot of time. It's a painful one, and it's entirely possible with the proper support system. Without ECS, there's no doubt in my mind that I'd be dead, and my family would have suffered an incredible loss. If there had not been an open bed for me at that exact moment, that I needed one, I'm certain that my story would be different. If there had not been a place for me to get help close to home and a support system to help me through those first 2 years, I assure you that my story would be different. Furthermore, if there had not been a place for me to get help when I did not have the financial means to pay for that help, because I don't know about you guys, but I don't know many drug addicts and alcoholics who have plenty of money to pay for the help that they need. Most of us are destitute. We don't have anything. We've spent all of our money, and we're a drain on society. So you get to choose. Do you want to spend the money on helping people? Do you want to have a place where people can go, or would you rather pay for them in your jails, in your institutions, and burying them? There's a choice. I implore you all to not only authorize another rehabilitation center, but to invest in it as well. There's no downside to this venture. There is no downside here. Okay, I'm not trash. None of the other alcoholics and drug addicts, they're not trash. They're humans. They're people. We're all people. And with the proper help, we can be productive members of society. Preventing another rehab from opening will certainly, and when I say this, I mean it, it will cost the lives of many people. There will be many lives lost if you deny this rehab facility. That's right. A no to this will mean people will lose their lives. The fact that there's a man who's willing to open a place like this should be embraced by our community. It should be embraced by all of us. As good citizens, as productive members of society, we should support this wholeheartedly. And I implore you all to do the same. Thank you very much.
Good morning, everybody. I am Marie Abenante. I'm a nurse practitioner. I've been working as a nurse for 21 years. My specialty is gastroenterology and liver diseases. You've already heard Justin's story. You've already heard what his mom had to say. You know what's going on there. I want to speak to you from a professional perspective. I see people every day who are dependent or addicted to prescription medicines that started out to help them. The average age of the addicted person that I see is 50. They're not young people. They're not teenagers. They're not kids that have gone wrong. And they're stuck. There is no way to get them off these medicines. They're with them for their lifetime now. These are professionals. They're CEOs who had back pain once upon a time. They're tradesmen who are literally working their bodies into the ground just trying to provide something to their families every day, and now they have chronic pain. And they were told lies. They were told that these medicines weren't addictive. They were told that they would help them. They were told that they were safe for long-term use. And I'm telling you, I'm sending them to Loyola for liver transplants. They are sons, they are fathers, they are daughters, they are mothers. They are in your community. If we do not do more to help end this epidemic, our economy suffers, our community suffers, and our families suffer. Please approve Dr. Sharma's request for another rehab facility. It is so sorely needed. These people need a place to go. Thank you.
Good morning. How's everybody this morning? My name is Dr. Michael Fisher. I'm going to tell you that I completed my doctorate at University of St. Francis at 53 years old. I don't know why anyone would go through that at my age, but I did it. I did it, right? I have a history of my family coming here to Joliet at the last turn of the century. I've been roaming around with Conflianos and Tubages and all of the other family members that are here still to this day. I grew up here at some level, right? I didn't live here, but I grew up an awful lot because I had family here. So I've seen Joliet go through lots of transitions. In addition to what it is that I did from an education perspective, I run a software company. I'm CEO. I hire a lot of people. So I'm going to ask all of you that are in the business at some level of managing people to hear what I have to say. Because, you know, people are hard to find. You know what's really difficult? It's difficult to find people that are passionate. You could teach a lot of people everything that you could teach them in the roles that you're in and the jobs that you're asking them to do, but you know what? You can't teach them to be passionate. They either have that or they don't. 5 years ago when Justin entered ECS, I was talking with Bipin Sharma because he was helping some family and friends that were dealing with addiction before ECS opened. I've been involved every day since. Why? Because these gentlemen that are here, I don't buy that they woke up one day and said, I want to be an addict. I don't buy that for a minute, and you shouldn't either. But you know what I've learned when I talk to Stephen and Santino and Maddie? These guys are here. They're going to talk to you. James, Danny, Joey, Brooke, Dennis, Michael, I can't name them all. Anywhere from a year to 5 years. You know what I learned? I learned that they really are impassioned people. And while that starting impassioned strategy didn't quite turn out the way that they wanted to as they became addicted, it didn't mean that we couldn't turn that passion into productive, driven, committed delivery, execution of something else in their lives. And I'm here to tell you that that comes from ECS. The treatment strategy, the way in which the staff, the alumni, the people that are here to talk to you, the way they embrace those that are in need is unparalleled. I've been to the other facilities we have here in Joliet, but I choose to do my volunteering here. Because for all of you that are leading people, don't you want to know that there is a facility in Joliet right now that is finding ways to uncover the passions of people that have not been productive in society? What did you say, Justin? Drain? And turn that into something that is very productive, that is driven, that is motivated, and that leads the community of those that are struggling with addiction into a place where they now get to contribute instead of receive. They now get to set the stage. They get to lead. And so I'm here to tell you, we don't have enough of that. Our friend from Silver Oaks talked about the number of deaths here in Will County. I'm here to tell you there's over 110,000 reasons for you to rethink that, because that's the number of people we lost this last year to addiction. It isn't funny. It's horrible. There's no stigma here. These are human beings. I love every one of them. I tell them all the time. I drive them nuts. But I do that because they're worthy of it. And we have to support that. So I'm here to ask you, please, if you're on the fence, jump over. If somebody else is on the fence, grab them and jump over with them. Pull them with you. Because this facility saves lives. So I'm going to please ask you, yes, yes, yes. That's the only way to vote. Thank you very much.
Good afternoon. My name is Stephen Bartolone, and I'm a recovering heroin addict. I've been clean for over 13 months from all drugs and alcohol. I went through Dr. Sharma's facility back in April 2021. Him and his staff helped me when many, including myself, thought I was beyond help. I struggled with addiction for over 20 years. Because of the help I got there, I'm able to be a productive member of society today. As many before me have talked about, there is an epidemic right now with opiates all across the country, but especially here in Will County. And there's not enough treatment centers that not only are willing to help, but have the bed space and are not requiring an HMO or a PPO. Dr. Sharma's facility accepted me when I was on Medicaid, state-funded insurance, because I did not have a job and I did not have the money to pay for it. My insurance, like Justin's, ran out a week before my discharge date, and Dr. Sharma let me stay there until I was finished with my treatment. He saved my life, and I just think that allowing him to open a third facility would allow him to save even more lives. That's really all I have to say in short, because I just think the more facilities like this we have, the more lives that can be saved. And this man saved my life. So, thank you.
Hello, my name is Santino. I'm also in recovery. I had about a 4-year relationship with ECS, with Dr. Sharma and his colleagues. And I wanted to talk a little bit about the character that is brought into the community of recovery that ECS has to offer. ECS has set a tone, purpose, and meaning to a lot of people's lives. Dr. Sharma and everybody within the facility treats everyone as family once you step foot into the place. There's a brotherhood you basically become part of, whether you like it or not. You're kind of just reeled in. A lot of addicts don't find in the world. We search for acceptance from our peers, from our family. A lot of us can't get that from anybody, and we feel comfortable when we talk to other people that are just like us. They get it. We get it. We understand one another. Fentanyl is killing people at high rates, if you guys haven't noticed, as well as addiction as a whole. And if you guys didn't notice something, I just want to point something out. Walking in, I don't know if anybody saw what was sitting outside. It's an opioid donation box, right? I mean, that's not there for no reason. The University of St. Francis right now is offering a recovery support specialist class for free. Again, that's not happening for no reason. This stuff is running rapid. A lot of men have turned their lives around due to ECS. It showed us there was a new way. And honestly speaking, if it wasn't for ECS, I wouldn't be the man I am today. It put breath in my lungs where there wasn't any. It put hope in my future when I didn't think I had any at all. My new self has been created due to the chance I was given through this program. It would be a shame if this facility isn't approved. More men will have a chance at being better in every aspect of their lives. I hope this has all been taken into consideration. Thank you for your time.
Good morning, everyone. My name is Jacob Cruz, and I am a living proof that recovery is possible thanks to life-saving facilities like Existential Counselor Society. CDC reported that the United States has seen over 100,000 fatal overdoses from 2020 to 2021. We are in a national state of emergency, and we are in dire need of more quality services. I have battled with severe alcoholism, cocaine use, and severe cannabis use on and off for a little over 13 years. And for the first time last year, I began snorting heroin, attempting to end my life slowly due to depression and fear of not having a way out of the misery. When I lived in Chicago and realized my vices extended from past traumas, feelings of abandonment, and internal struggles, I made a conscious choice to look for a program where I can receive the necessary help to end my severe usage and live life with purpose and meaning. I lost my home, my job, my fiance, my family, and most of all, I lost myself. Unfortunately, well-needed services in Chicago were exhausted and at capacity, which threw me for a loop. It was either the beds were filled up or that many facilities were closed down due to funding issues and COVID. I believe that it was by divine intervention that I was able to find the Existential Counselor Society in Joliet and receive the necessary help to realize how I can manage my life without any life-threatening substances or chemicals. Today, I have a place to live, a full-time job, I have my fiance back, and my relationship with my family is stronger than ever. This wouldn't be possible without ECS. We are not just focusing on the drug use, but the root cause. I've witnessed firsthand the importance of more support services needed for us fighting for our lives back. We can't do it alone. Existential Counselor Society is one of those support services. I have had 9 buddies die since I started my journey. Now we have children without a father and mothers without a son. This should not be the case. I'm better today because I was honored to have been in ECS, a program that met me where I was at in my journey to recovery without stigma and bias, which, like most of us battling severe drug use, face on a daily basis. Joliet is in a state of emergency, and the number of people dying is growing, and we need to come together and fight back. We can only fight this war on drugs together as a community and not alone and secluded. Today, I ask for your support and extend and expand services with an inpatient drug rehab center, ECS3. Statistics show that a majority of fatal overdoses are happening due to not having access to the next level of care. After an individual completes a hospital detox day, they are then released back into the environment without a warm handoff to an inpatient drug rehab. The problem with this is that an individual's immune system is now compromised due to being without the drug, and once they are released back into the street, they use the same amount of opiates, not knowing that now it's a 90% chance of a fatal overdose. Lack of housing, food, employment, mental health services, basic needs, stability are all factors in the cycle of severe drug use. Drug rehab programs provide us with a fighting chance to win this war on drugs, this war on us. This war is here in Joliet, Illinois, and we need to keep up with the demand of negative consequences due to these fatal drugs in our communities that have been proven they are here to stay. Please support ECS3. Our communities should not go without. We need help, and we need it now. For some of us, tomorrow is too late. Thank you for listening and for your generous time. My name is Jacob Cruz, and I support ECS3.
Good morning, everyone. My name is Matthew McCullough. I'm going to talk. I had an addiction for 13 years. It started with prescription pill use and escalated to heroin and cocaine IV use. I'm not going to get into that. What I want to talk about is what ECS has allowed me and other men who have talked and are going to talk to do for the community. When I was in my addiction, I took care of myself barely. These days, things have changed. I run gyms at both of the facilities for men to get physically healthier while they're at treatment, getting mentally healthier, fighting their addiction. Several guys here work for me, and we do that to help the men there get healthier. It's also allowed me and others here to go in and speak to the guys, talk to them about real stuff they're going to face as they get sober and they come out. You know, the issues we've faced, and we know that everyone else is going to face too. A few of us have started a YouTube channel to give back to the community, talking about topics that have to do with recovery and life in recovery. None of this would be possible for me or any of these other guys that we do this together without ECS, without have gotten recovery. And I had went to one rehab before and it did nothing for me. The way ECS and my relationship with Doc that has grown over the last 3.5 years I've been sober made that possible for me, and it's making it possible for me and many others to help our community be better men for our families, our wives, you know, everyone involved, and just people I even work with, you know, and I know that's true for everyone. I'm just speaking for myself, but I support a third facility because, like many have said, there is not enough treatment available. And the treatment at ECS, I believe, is absolutely top-notch because they deal with the root of your problem, and that's really the way you can get a hold of it. So I'll keep it short. That's all I have to say. I thank you for your time, and please approve this.
Hi, I'm Michael Keene, recovering addict. I'm writing this letter on the importance of treatment facilities in Will County and Joliet. Existential Counselor Society has 2 or 3 centers, treatment centers that I know of in Joliet. Joliet is the 3rd largest city in the state of Illinois. Existential Counselor Society helped me get my life back. I've been to 8 treatment centers in the state before I went to Existential Counselor Society. ECS is different in many ways, the first being based on their one-on-one counseling sessions to talk about the trauma and grief, also to get down to the root of why an individual uses different substances. This is the first place I've been to where I wasn't just a policy number to Dr. Sharma and the staff there. The second most important thing is it helped me find housing, build a relationship with my family and children, help me get my integrity back, and give me a second chance at life. They also got me into the Will County Recovery Coach Grant Program to begin a career path for me to help others like Existential Counselor Society helped me. I'm writing this letter with over 3.5 years clean from all mind-altering substances, and none of this would be possible without the hard work of Dr. Sharma and the staff of Existential Counselor Society. Thank you.
Sorry, need to bring this down a little bit. I'm coming here today in support of Dr. Sharma and
Can you
ECS.
say your name, please? I'm
Oh,
sorry.
I'm Mary Ann Liegi. I'm here as a mom and as a certified recovery coach. But when it comes to addiction and your child, me being a recovery coach, I couldn't help my child. It just doesn't work. And I met Dr. Sharma almost 4 years ago. My son tried to take his own life with drugs. And when I received the call and he was laying dead, not breathing, and they were hitting him with Narcan, and the ambulance came, they took him to a hospital. They just gave him fluids, and they said, get him into treatment somewhere. He's been in treatment many times before, and nothing helped. A friend of mine gave me Dr. Sharma's number. I called. He helped me get him into detox. He was there for my son, for my family, and I implore you, we need this. I wouldn't have my child if it wasn't for Dr. Sharma. He saved his life. I truly believe this. And I know that you all know somebody, a son, a daughter, grandchildren. But I'm telling you, as a mom who saw her child not breathing, to have a chance to have my child back. And not only for my son, but he's there for the whole family. I've called him and he's talked me off a ledge because I was hysterical and worried, and he helped to show me not to enable my child. And he has always been there. So I am telling you, from a mom who almost lost her child, please say yes to this. We need this. He does not do it for profit. He does it because he cares. And in this world, that is so very rare to find, because as many of these men who I do know, who are also there for my son through alumni, who have talked to me as well, it is a community of support, but you don't find that out there. If you don't have private insurance, they have a few state beds, and it can take 6 to 8 weeks to get him in. And in the meantime, your child is running the risk of dying. But Dr. Sharma, he was able to help my child get to the root of the problem, dig deep, work on it, find out how to deal with his anxiety, how to deal with the issues, and it helps. So I might not be the best speaker in the world, but I'm talking to you from the heart. Please say yes to this. Thank you.
Good morning. My name is Michael Cervantes, and I am a recovering alcoholic and drug addict. I'm here today only because of an open door policy that ECS has. I am a proud alumni and a brother in arms. Many of these guys in this room that you have heard speak and that are here present are my brothers forever. I had roughly a little over a year ago, I had given up on myself completely. I am not a young man. I'm well into my 50s. And I had been to several treatment centers, which I had very little success with. On the early part of May 2021, I had decided the only way out for me was to die. And I had decided to take my life. And I reached out, and luckily the fire department and paramedics of Joliet thought otherwise. And I was taken to St. Joe's, and that's where my journey began. I stayed there, sobered up, and I was transferred to Lake Behavioral Hospital in Waukegan. I found that kind of odd because I'm from this area and it was so far. But nevertheless, they had an open bed and I needed help. There I met a social worker who saw something in me and immediately started reminding me that I'm worth it and I can change. And she thought that ECS would be a perfect fit for me. I mostly have dealt with AA and NA, and there's nothing wrong with that. It works if you work it, and it is available. I had known nothing about Smart Recovery, and that's what Existential Counselor Society is. They taught me immediately to start believing in myself, tapping into things as far as what the causes are to my use and abuse. I wrote this short letter, and only because I had reached out to Doc, call him Little Doc, on Monday, because on May 13th of this year, I achieved 1 year of continuous sobriety. And thank you. So I reached out to Little Doc because of the open door policy, and I wanted to share with him my joy. I'm alive and I'm successful right now, and I'm living, and I'm proof that it works. So I wrote this letter. Hi, my name is Michael Cervantes. I am a recovering alcoholic and addict. I am writing this letter testimonial on behalf of ECS treatment centers and of my own accord to let people know that addiction treatment centers are a vital and necessary place for people who struggle with addiction can go for help. Help meaning, as a client of ECS, I was educated and shown about my disease and what I need to do to face and fight for it. I was told and taught by my father at an early age that knowledge is power, and somehow I've forgotten that. This began at a very young age. Coming to ECS helped me to find out why I abused drugs and alcohol. It helped me to figure out who and what I am and what I needed to do to live a somewhat happy and productive life of society. Maintaining my sobriety, I found out issues that I had with myself and was shown how to combat these issues. I had let my addictions rule and run my life, or shall I say my existence, because I was not living. Today and since May 13th of 2021, I have been and will remain to be sober if I continue to do these small things. Life and being a productive person of society again. I also know what I learned to share with other alcoholics and addicts to show them there is a better way to live, sober. I found out these things about myself, pleasant and not so pleasant, but nevertheless a way to live. Most people do not know much about alcoholism and addiction, are not educated. Being a client of ECS, I was re-educated and taught how to address my issues so that I can lead a somewhat normal life. Having these things, these tools I learned at ECS helps me to fight my addictions on a daily basis. I feel it is imperative to have more treatment centers like ECS, and I am total in favor of ECS 3, and I ask for your approval of this amendment, or this motion. I can now live a fruitful and fulfilling life if it is as simple as just being a good father, a good papa, and a better friend to my brothers and to people in society who need help. Then I'll do the things I need to do. I am alive today because of ECS. I am, and my family is blood and chosen, is reaping the rewards of sobriety. And in closing, I would like once again to say, knowledge is power. Sincerely and forever grateful, Michael Cervantes.
My name is Dennis Carr. I'm also a recovering heroin addict of 23 years. So I wrote this big long letter, and just kind of standing here listening to what everybody had to say. I was debating whether I wanted to read this or not, but I'm going to read this, and then I'm going to speak from kind of a few things that just popped into my head. I'm writing this letter to explain why and how drug and alcohol treatment facilities are so important to have. especially in Joliet, considering the outrageous drug problem that we do have here, and it seems to be climbing faster day by day. In addition to stopping drug abuse, the goal of treatment is to return people to productive, functioning member of society and their family and a workplace and into the community. According to research that tracks individuals in treatment over extended periods, most people who get into and remain in treatment stop using drugs, decrease their criminal activity, and improve their occupational, social, and psychological functioning. Like other chronic diseases, addictions can be managed successfully by treatment. Treatment enables people to counteract addiction's powerful disruptive effects on the brain and behavior, and to regain control of their lives. The chronic nature of the disease means that relapsing to drug abuse is not only possible, but also likely, with symptom reoccurrence rates similar to those for other well-characterized chronic medical illnesses such as diabetes, hypertension, and asthma that relapse rates between drug addiction and other chronic diseases also have both psychological and behavioral components. Unfortunately, when relapse occurs, many deem treatment a failure. This is not the case. Successful treatment for addiction typically requires continual evaluation, modification as appropriate, similar to approach taken for other chronic diseases. For example, when a patient is receiving active treatment for hypertension and symptoms decrease, treatment is deemed successful, even though symptoms may recur when treatment is discontinued. For the addicted individual, lapses to drug abuse do not indicate failure. Rather, they signify that treatment needs to be reinstated or adjusted, or that alternate treatment is needed. Why is addiction treatment evaluated differently? Rehab is designed to provide those struggling with substance abuse the right tools and resources to overcome addiction. Anyone that is struggling with an addiction to drugs or alcohol will benefit by going to treatment. Those who have suffered from addiction know how hard it can be to overcome it alone. And the healing environment of rehabilitation offers support needed to make a successful recovery. Rehab includes individualized treatment plans to help patients identify and overcome the underlying issues that started their addiction. While the main priority of rehab facilities is to help patients overcome addiction, there is an abundance of other benefits of rehab as well. In addition to conquering one's addiction, those attending addiction treatment will also learn the necessary tools for building a productive, healthy, and happy life. I'm not going to bore you with the rest of the technical details. I'm sure you guys probably all know about that part of it. But again, I'm a recovering addict. I did heroin for 22 years and several other drugs in between. I went to ECS myself in March of 2019, and I have just over 3 years sober. I'm originally from Berwyn. Joliet was the closest place that I could even find that had a bed available for a treatment facility. When I came into ECS, I was defeated. I had no sense of self-worth, no motivation, no drive. I had committed suicide by overdose March 17th, 2019. It was pronounced dead at 11:27 p.m. by the grace of God and the paramedics. I was able to be revived. When I came into ECS, I had no reason to live. I didn't want to live. My dad passed away of lung cancer in 2018, and since then, I had no purpose for life. After attending ECS, I left there with a sense of self-purpose, and I was learning who I was, and that wouldn't have been possible without treatment, without the counseling, without having that bed available. Since then, I've learned to love myself. I have a reason for living. I'm married to a woman that puts up with me, and I have a 9-month-old son. something that I never thought I'd experience again, because I was a deadbeat dad for 20 years to my older child. And I lost another son of mine to the state of Tennessee when I went to prison, and I was a single father at that time. So I get to relive all this now, and I get to do it sober, and I get to enjoy life. I've bought my very first house. I have a good job in the recovery community, helping people and making a difference in people's lives. And none of that would be possible without ECS. Like I said, everybody here knows how big the problem here in Will County is. So to try and turn a blind eye to that, and even think of saying no to another facility here in town would be absurd. I think we need as many people as we can to help us. So I'm here to support Dr. Sharma's third facility. Thank you.
My name is George Chandler. I live in Olympia Fields, which is in Cook County. Sorry. We need you in Cook County, Dr. Sharma, so build some facilities there. I support Dr. Sharma in his work. There's a tremendous need to have alcohol and drug treatment centers to help fight the addictive alcohol and drug epidemic that's facing our country. I have friends and relatives and acquaintances who have had issues over the years with alcohol and drugs. Some have survived and some have died. My 3 adult children have had friends and relatives, friends of friends, and their children die from drug overdoses. The family unit becomes strained. Many times it falls apart and never recovers, creating additional social and economic pressures on local government. Dr. Sharma and his treatment centers can help these people and their families survive, maintain, and grow. His centers help increase the quality of life for individuals and their families and friends and their community and their county. His patients become useful to society, not burdens. Please support Dr. Sharma and his project. Thank you, Dr. Sharma, for your dedication and commitment to help people get their lives back.
Good morning. My name is Brooke Melvin, lifelong resident of Joliet, homeowner, business owner, father, son with parents who are proud of him. That wasn't always the case. I'm also that guy at Jefferson and Larkin with the sign asking for your money. There were so many times that I needed treatment and even times that I wanted treatment. And I was told to call every other day for the next 3 weeks until a bed was available. And I stayed out there, and I'm one of the lucky ones. I'm still alive. A lot of people don't get that chance to make it for 3 weeks. I thank God and I thank ECS that the bed was available, and I've turned my life around. I now work in the field. You know, yesterday, and I wasn't going to tell this story, but yesterday I kind of had a life change. I also work in the field, volunteer in the field as well. But I went to a family's house and I sat with the mother and father in their kitchen, and the mother was crying, father teary-eyed. They wanted help for their son. And after 4 hours of driving from facility to facility, we were unable to find him a bed. And when I pulled back in his driveway and saw his parents deflated, I mean, it just shouldn't be that way. You know, I want to reiterate what Justin said. It's almost ridiculous that we're having this conversation right now. This isn't another smoke shop or liquor store. We're talking about something to help somebody. I mean, you know, we got to get it together. So, you know, I'm here in support of the third facility and the fourth and the fifth and as many as we can get. That's all I got. Thank you.
Good morning. My name is Tom Moore. I am a resident of Will County for 31 years. I'm also the founder and facilitator of a family addiction support group in New Lenox. I've been running for the last 6.5 years. I'm very passionate about this. I lost my son to the disease of addiction 8 years ago. And the pain is immense. It doesn't go away. But I found passion. We talked about passion earlier. And my passion now is helping people. And, you know, I'm proud to say today, my daughter, I have 2 children. My daughter is in recovery. She'll be celebrating 4 years of continuous sobriety on June 11th. Recovery can and does happen. That's a story that people need to hear. My letter to the board goes like this. Will County board members, I'm writing you this letter to encourage you all to vote for approval on the proposed Existential Counselor Society Treatment Center. Back in November of 2016, ECS opened its first inpatient alcohol and drug treatment facility in Joliet. Dr. Sharma, the CEO of ECS, turned a vacant daycare center located at 2319 Manhattan Road into a beautiful facility where men can begin to heal and become productive members of society. You've heard quite a few of them here today. After several years of success, accolades, and the ever-increasing need of the population, Dr. Sharma then turned an abandoned eyesore of an old grocery store into another beautiful new facility at 1225 Richard Street. And ECS 2 was opened in March of 2021. Currently, the demand for regulated treatment facilities is at an all-time high. We all know that. Dr. Sharma continues to serve the population of Joliet and surrounding areas with a unique treatment modality. Clients are viewed as individuals, and treatment includes a minimum of 12 hours of one-on-one professional counseling during their 4-week stay. Clients gain knowledge as to the why the alcohol and drugs consume them. This understanding is critical for clients to be able to move forward in sobriety. At a time when so many political decisions seemed influenced by money and clout, I urge you to vote for the best interests of the whole Joliet population. Existential's 2 current facilities are making a difference in the lives of many people. The question is, are you ready to do the right thing and continue in the fight for more treatment facilities? This community needs more beds. The addiction epidemic is, in my opinion, the most important issue this community and our country currently faces. I want to thank you all in advance for your vote of approval for ECS 3. Thank you.
Good morning. My name is Joseph Matola. My letter is a little short here. So to whom may concern, I am writing this letter to support Dr. Sharma and what he does for the recovery community. I was formerly an addict and was facing homelessness and worse, death. With the help and care of ECS, I am now living a sober and healthy lifestyle. I now am also an employee of ECS. Seeing the patients progress from the time they come in to the time they discharge is amazing. Having this facility open is a great asset to the community, cleaning up the streets and saving lives. When our clients leave ECS, they become contributing members of society. Opening this facility is the right choice. It saves lives and it offers a positive impact in many lives. Something else I kind of want to say, as far as when we're talking about, Dr. Sharma, I don't really know of many other rehab facilities. I'm not bashing any other facilities, but from what I've heard from most people that clients that have been to other facilities, you don't see the CEO of a rehab facility being as involved as that man up there. He counseled me. He counseled a couple of these guys over here. He definitely saved my life, you know. So again, with what a couple of these guys are saying, you know, why we're even here having this meeting, I understand that we have to have it, but it's just, you know, it's kind of little goofy. So I just want to thank you guys all, and you know, the right choice is to agree on this. Yay! So you guys have a good morning, okay?
Hi. Good morning. My name is James. I am also a recovering heroin addict. I've struggled with my addiction for the past 20 years of my life and was on the verge of losing it. January 30th, 2021, a childhood friend, also an employee at ECS1, had reached out to me and told me there was another way of living my life without a drink or drug. At this time, I was homeless, addicted, and had no real-life resources to better myself whatsoever. So what was even the point anymore? That was the day my friend Michael Keene had picked me up and took me to a detox where I soon after started my journey of recovery. It was no walk in the park, but ECS had given me the proper treatment, therapy, one-on-one counseling, interaction with gentlemen that were in a group they call alumni, that came to talk with us once a week about living life in recovery, and the list goes on. When I came up on the end of my treatment, I was in a fluster because I had no credentials to anything. No job, no housing, no communication skills, etc. Dr. Sharma and crew helped me with everything in bold letters in my letter. And that was the first time in my life I felt like I had a family and people who cared for me. Over the last year, I have worked very closely with Dr. Sharma with continuing on helping other suffering addicts, trying to guide them in a direction that I had to get through where I am today. And one of the hardest things we struggle with these days is finding a facility that will accept us with the bare minimum. ECS and DOC have given the opportunity to me and many more. I've been blessed with so many beautiful things since my stay at Dharma's first treatment facility, like reconnecting with my daughter and blessed with a beautiful, beautiful boy who's 3 months old. I've become a leader at my job, a provider for my soon-to-be wife, son, and daughter. I have continued to stay connected with the treatment facility with one-on-ones to help me with guidance through life-on-life terms. I'm a leader in Sharma's alumni group. I have gained the trust and love of so many of my brothers. I work closely with gentlemen that are getting out of treatment and that can relate to similar struggles I have been through and guided them through the ups and downs that come our way. There is no greater feeling than seeing a man that is completely defeated. His whole life, has been completely defeated, as I was, and all of the other brothers that are here right now. Get an opportunity to be blessed with brotherhood. I don't know about everyone else, but I sure love to see people come out of the depths of hell and be given a second chance at this beautiful life. And that's exactly the opportunity that this third ECS will be doing, is giving more future brothers of mine a second shot. I'm wholeheartedly in this with Doc to help save lives and hope you all will see this too. Thank you so much for your time. Sincerely, James.
Good morning, everybody. My name is Daniel Ingram. I was in ECS in February 2020, going into the pandemic. I worked from 9 to 11 yesterday and was on the road at 6. I live in Indiana now. I affect my community in so much. Every single person I meet, I make it a point to to change their view on life and have a good outcome. And my mother has her son today and will continue to have her son because of ECS and the core group of counselors and doc and the brothers and alumni and everybody that has gone through the program, and it continues to like fight addiction because it doesn't stop. I'm still an addict, but I have a home, I have a job, I have a career that I would not have had. I was in such a spiral, and I was just sucking off of my family, and I was just looking to end my life in any way possible. I was given the tools to live my life, and I owe them everything. ECS 3 is an opportunity to end countless amounts of lives. I mean, to help countless amounts of lives, sorry. Vote yes. Thank you for your time. My name is...
Good morning. My name is Tony Madonia. I'm a CPA and an attorney, have a law practice in Des Plaines, which is in Cook County, so I feel like a little bit of an outsider here, but people have made me feel very welcome. Thank you. I've worked with Dr. Sharma with ECS for the past 5 years or so. I feel that I know him very well. I've been to his house. I know of his wife and his children. I've spent a lot of time with him. I've spent some amount of time with people that have been through his program, helping them address various legal challenges that they stumble upon. We've heard people talk about the effectiveness of his program. We've heard alumni say that. We've heard clinical people talk about that. I think we all understand the overwhelming demand that there is for what ECS does. I won't spend any more time on that. I'm really here to talk about how he runs ECS 1 and 2 and the character of Dr. Sharma. Early on in our relationship, I would meet with him and go through financial results, and I'd say, you know, Dr. Sharma, businesses, they typically don't do things like this. And he'd say, Tony, let me tell you about Bill, and let me tell you about Sam, and let me tell you about Joe, and let me tell you about Ralph. And I learned early on, okay, financial ratios and models, we're not going to waste any time on those because that's not how this man operates his business. He runs his business measuring profit and loss in the number of long-term recoveries he can produce. The way that those businesses are run is an extension of his character, and he's in it only because he cares. And this is from the person who prepares his financial statements. I implore all of you to please vote in favor of ECS 3. Thank you.
Good morning. My name is Syed Zaidi. As of April 21st, I became a proud member of ECS, proud alumni member of ECS. Never would I have predicted this journey. Now I wouldn't trade it for the world. I've been silently struggling with a drug addiction to crack cocaine for the last 3 years. Before my addiction robbed me of everything I had, I was highly successful. I was a fully functioning executive. I had it all: beautiful family, fulfilling career, spiritual connection, supportive social network, and hobbies I thoroughly enjoyed. I have a ridiculously large family right here in Will County, and I was known as the golden child before I became the black sheep. It took now my ex-wife and my 4 beautiful children moving out of my home to recognize that my priorities were skewed. Because I was too busy getting high, I missed out on priceless family time that I will never get back. It took me facing legal charges, jail time, you know, to realize that my addiction was spiraling out of control. Culturally, you know, there's a stigma surrounding addiction and mental health. It's not understood, nor is it accepted. Because of that, I was against this type of this treatment modality for years. Getting the help I desperately needed at ECS not only opened the doors for those in my community, but those individuals silenced within my culture. Having a facility like ECS right here in our community is an absolute blessing. According to the CDC, you know, there were over 100,000 deaths due to overdose in 2021. That statistic is absolutely frightening. And it speaks support, you know, to the community that we desperately need, you know, help in this, you know, within addiction. Basic needs that get neglected during natural during the height of my addiction, and having aftercare help, aftercare arrangements like sober living, obtaining ID cards, unemployment, contacting insurance providers is something that ECS helped me with as well. The smart recovery approach implemented at ECS was a game changer for me. It changed my mindset. It took, it had more of an impact on me than other traditional models do. Along with the motivation to change healthy coping skills and positive thoughts, feelings, and behaviors, I now can live a balanced life without my addiction. ECS helped me see that although we can't change the past, there's something I can do about now and the future. There should be no argument about the approval of ECS. We know that the need is there. We know the statistics don't lie. And I feel like getting approval and letting Dr. Sharma, without a doubt, be afforded to have the opportunity to continue what he does best, which is provide treatment for a struggling population that could use some hope. Thank you for taking the time to listen to me.
Hi, everybody. So listening to everybody's story today, super moving, right? Awesome. I myself, though, live in the Sunset Point community, okay? I also have people, my uncle tried to commit suicide. He was a drug addict. Although I'm urging everybody, because I didn't know about this treatment center. I live there. We just moved there, spent $300-something thousand on a home. And like the person before me who spoke and says, there's a lot of misunderstanding and a stigmata about these treatment facilities. And we heard of all the successful stories, but what about the other people that do not succeed? And I feel like in our community, as I just moved here from Volo, why do we need a third one? Why can't our community, and again, I am so easygoing about this, but why is there such a heavy concentrated area where they can't build anything else? And I'm for treatment centers, okay? But why so many? And why is there a liquor store a few doors down? Why? Why? It just doesn't make sense. And living in this community, spending all my hard money to then have to explain when I want to sell my house later on down the line that there's 3 treatment centers right by me. Again, I could relate because I've had that loss. I've had alcoholics. I was growing up with somebody, my mom, when my mom and dad were divorcing. My mom left for an abusive alcoholic. So I understand everyone's fight, okay? But the problem is, like people said, there's a stigmata attached to it. So from a financial standpoint, where I work hard for my money, why should our community be punished? And that's not just me. I represent the minority today, and I understand that. So hopefully I don't want to be out here and saying, that's the guy who says he doesn't want it. Look, again, I'm okay for it. I just don't want so many in where I'm living. It's a brand new community. It's a brand new community with a liquor store right next to treatment facilities. That's the issue, really, right? It's just one of the things that, again, it's not just me, because I didn't know about this. I'm brand new to the community. I got a flyer stuck on my door, okay? I live in Northbrook, so far away, but I didn't want to spend my time doing this. But I guess I am the only one here today, because most of the other people in our community, it's a new community, are working. I'm fortunate to have the day off. So I am the only one here, find it bravery or not, that would like to say no to this and put it somewhere else. And that's all I have to say. It might not be the most popular opinion, but I am the only one. My wife's here too, but she just can't voice her opinion because she speaks Chinese, and her voice too. And I'm speaking for the people that took the time to do that too. Okay, that's all. And again, like I said, for the people that are successful, congratulations. That's awesome, because I've experienced this whole in my life too. But what about the ones who are not successful? We're not hearing from them. And that's what, as someone who lives in this community right there, right across the street, I don't want to take that chance. And it's not just me. So it's my community. So I guess I'm the only representative today.
And I'm going to have to, can you send me, you didn't say who you were, so we need it for the record, sir.
Oh,
Sorry.
my name's Robert Damasco.
Thank you, sorry.
Sorry.
Yeah, no,
I sent
good.
an email too.
Okay, very good. Thank
So-
you. Thank you, Robert.
Okay. But yeah, so that's it. That's all I have to say, you know. Thank you.
Yeah, and just a reminder, you can only come to the podium one time, sir. Yeah. Nice try. State your name.
Good morning. My name is Angela McClellan. I'm with the Will County Substance Use Initiative. And yeah, dude is a hard act to follow, but guess what? I got it. Don't even trip. So listen, I'm originally from Chicago. I'm not even from Joliet. But my road to recovery started here. I've been here now coming up on 3 years. This is my recovery family. I do the community work, right? And it's not always glorious. I want to speak to you guys in terms of the financial aspect. I understand that, like he was just speaking about, his community and him buying a home, right? But social services is never a glorious field. It has never been a glorious field. It's a field that pulls at your heartstrings. It's a field that requires empathy, right, for your fellow man. So you're not going to get a lot of likes on Facebook and Instagram and when you're doing this kind of work. But it's imperative that we do it because we are losing people every day. So I get it. I get it. I understand the gentleman's beef. I understand that. But financially, we have to make the commitment to save people. Is money more important than a person's life? We saw countless examples of up here. Recovery, our mission is simple. That any addict can stop using, lose the desire to use, and find a new way to live. And you saw that with each gentleman that came up here and spoke about how they're back in their families' lives, how they're raising their children, how they're productive members of society again. Right? And that's the thing that is priceless. That right there is priceless. We are all miracles, right? Because the gentleman also said, who's not here to speak about the failures? I was over there laughing because I said they can't speak because most of them are dead. They're no longer here. They didn't get the chance that I have to stand here. So I stand here and I speak for them. I have never met the gentleman who has the EMS facility, but I support him 100%. I support him because he is changing people, he is saving people. And at the end of the day, if you are still wrestling with something that saves people's lives over making a dollar, I don't know what else to say behind that. My name is Angela. Thank you for allowing me to speak.
Good morning. I'm Thomas M. Ledwell, alcoholic and an addict. I was asked to come here this morning because apparently we need another treatment center, which is obvious. I was an alcoholic and an addict, basically medicated since I was 5. I have never been to treatment. I go straight to prison every time. I have been, again, since I said I was medicated since I was 5. I grew up right here in Will County Adult Detention Center, which had a B pod in it, which was boy pod, where I was at when I was 12. And it's basically been the same result every time the door was open. I was like a rabid dog that just did what he wanted to do and had zero guidance. I was also raised by an alcoholic, so I didn't really know anything different other than my normal routine was just that rabid dog. That's all I ever knew. Which just the same result every time. A steel door, just a different one slamming shut behind me. And I am a proud member of Alcoholics Anonymous, who would have nothing to this day if it weren't for the people that came through that program and seeing them in action, because I wouldn't listen to anybody. I didn't give a shit what any one of you said. None of it mattered. None of it stuck. I could only understand words that came from somebody that had been through something similar, maybe not the same experience, but you know, something similar. And that was the only way I would even think about listening to you. And again, I can't speak either way for treatment. The same as the other guy said, I tried making a call when I was ready, which the bottom is huge. Like for me, it was my mother dying, and I made that phone call, and they told me that I had to call back. There were no bed space available, and I was supposed to call back the next day, which was not going to happen. There was that brief window where I was ready, which I've seen a lot now. You know, I think I came in about 5 years ago. I have about 4 years of continuous sobriety, my sobriety, which I'm grateful for, and it was given to me by these other people I'm talking about that had walked this path. And when the fog cleared, like I was led around like a child. Somebody basically held my hand for about 3 or 4 months until the fog cleared, and they had all been down the same path. Like I said, maybe not the same path, but one similar. And it was the same thing. I had gotten out of prison. My mother died, and I had half my goals were my mother not passing before I got my shit together, my life together. Sorry about my language. I'm not the most literate person in the room, I'm assuming. But it was these other people that had been through this before, this experience. They shared their experience, their strength, their hope, and that was what I was able to grab onto. And fear, if it wasn't for fear of that same result every time, just a different institution, I wouldn't have anything. And fortunately that this Dr. Sharma was there the entire time through, it's not just this treatment center, it's not just Dr. Sharma, it's the people, and I see them everywhere in these rooms, they're right here too, that helped me get my shit together, and they're all part of this community. And like I said, if I couldn't see this stuff in action, I wouldn't even be here. It's an everyday part of my life today. And I've been blessed with the ability to talk to Doc. His phone number, he's been huge. Like, I've helped pick people up from these institutions. I help drop them off. I see them when they go in, and then pick them up and take them to meetings and do the same type of hand-holding things that were done for me that I am so grateful for. Like, and you can see the fog clear. I see him go in with nothing. The only alternative is jails, institutions, and deaths, and they find these institutions. ECS for one, which I see it. I see it every day. Every time I go to a meeting, I see it in these rooms. It's hard to deny, because myself, I still pay my bills when they're red. Don't get me wrong. I have no, like, just walking every day, simple stuff that I had no clue how to do. Like, I could not understand me going to work every day and investing everything I had and then giving it to anybody else, anybody other than myself or the dope man. Pretty much that's where it all went. And then whatever I could take from you people that would keep me out of prison enough that I hid in the shadows, and I couldn't look in the mirror. And today I call myself a productive member of society. I am a business owner. I'm going to pull permits to build in your community when I leave here. I have guys that have come from this program that we're talking about that work for me regularly and watch them grow. And it's just amazing. Like, rode my niece's bike. I got on my niece's bike at the top of a hill, just not wanting to be sick. It was all downhill, and I went to AA, and that's where I found these rooms and these people that have all walked this path before me. And I don't think they would be around if it wasn't for Doc. I mean, I can't speak for all of them, you know what I mean? But I know the ones that I've dropped off myself. I have walked to this institution and picked them up from this institution and taken them out into society, and they are 100% different people, and they're, man, this shit just hurts. Like I said, I go straight to jail. There's no ifs, ands, or buts about it. There's nothing you people could tell me. When I choose to get high, that's it. There's nothing going to stop me. And if it weren't for the other people that have been down this path, it's, man, I wouldn't have anything I have today. I wouldn't, like my mother owed $7,000, $6,000 on taxes on her house when she died. I am a union carpenter. I make $2,000 a week, and I thought that was the end of the world. The house is gone. It ain't happening. It's, nope, can't do it. And then I still have that home today. You know, I can't say it's mine. You know, it was my mother's, and every day, during a day goes by that I'm not thankful that she provided the place that I have to get my shit together. But it's always been the same result every time. Jail, another door. And then there's more doors behind that door. It's not just I go to jail. They got more doors in them rooms, man. It's they got special places for people like me with no windows. And I found them all. Hey, again, it's Thomas M. Ledwell. You could look me up. It's I have been a part of this community. Most of it has been a hurricane until recently that the storm has ceased. But it's, again, I can't speak any. There ain't a damn thing I have that isn't from these people that are working these programs. I don't care. Smart recovery, that's great. You know, I see it working. I can't speak for it. I see it in action. I see that shit walking around these rooms. It's in line right here. That's AA right there too. And that, like in my program, they say that the big book is, they might never see it. I might be the only big book that other people ever see, you know, and it's, and that's how I carry myself today. My actions, because I know that I wouldn't have shit if it weren't for the other people that came from where I'm at and put that foot in front of each other every day, went to work and actually gave you people the money that they were supposed to, paid their bills and shit. And I wouldn't have any of this. I wouldn't be able to do any of that today if it wasn't for this community, the people in it, and yes, Dr. Sharma, and I am in favor of this ECS 3, and that's about all I got.
Hi, everyone. My name's Paul Hempel, and I'm going to read a short letter that I wrote, and I asked for it to be read into the record, but since I'm reading it, it doesn't have to be read in there again. And I'm going to keep it short because of pretty much my story is no different than anybody else's, but my name's Paul Hempel. I live in Will County since the spring of 2011, which happens to be when I came here seeking treatment for drug addiction. I have remained clean and sober since April 8th of 2011, which is over 11 years now. And I have stayed plugged into the community helping others to find sobriety. Unfortunately, the problem has continued to grow while the resources available are not keeping up with the demand. Detox, inpatient treatment, counseling services, sober living, transitional living resources just can't keep up with the growing demand. Our local hospital ER departments are full due to the increasingly high number of overdoses in our county. On a personal level, for me, the person I love the most and the mother of my children was one of those fatal overdose statistics last year. The need for additional treatment options, especially for people that are state funded, which is a majority of what our county sees, has never been greater. I have experienced the greatest gifts in life as a direct result of treatment options that were available to me 11 years ago. We need to, as a community, do everything possible to ensure that everyone who is struggling has those same options. Growing these options is required if we want to get ahead of this epidemic. The benefits extend further than just the patient. Our families, hospitals, employers, schools, police departments are just some of the major areas that our communities need the help that comes when people recover and become responsible members of Will County. That's pretty much the extent of my letter. And I was just going to let everybody read it, but then it really becomes personal. My voice doesn't shake much when I speak, but just two things on a personal level. I know Doc Sharma and everything that he does. I can't tell you how many people that, just like everybody else here, that I've helped get into that facility. There's absolutely hardly any options at all for people that don't have anything less commercial insurance. I actually work for a treatment company that only takes people with commercial insurance. I can tell you in 10 years how many people I placed into treatment with commercial insurance. I can't tell you how many in the last decade that didn't have it. So that need is really great. And I just want to close because the one gentleman in opposition held up a flyer. I live in the Sugar Creek Hills subdivision, which is directly across the street from where this is going. I can walk with my daughter to any one of Doc's other facilities right from my subdivision. That flyer was circulated in my subdivision. It was posted on the Facebook page for our subdivision on April the 1st, and it only got 5 comments, all which were in favor, and nobody negative. So to my knowledge, I can't speak for everyone that's in that subdivision, but we don't have any problems with it, and we're a large subdivision right in the middle of it. That's all I got.
Hey, everybody. Good morning. I think it's still morning, right? Yeah. Almost. My name is Michael Sturba. I am a member of Will County. I live here. I've grown up here my entire life. I pay more than my fair share of property taxes here. My sobriety date is February 1st, 2012. I celebrated 10 years of sobriety earlier this year. I say that because, like, I would have had 11 had a bed been available for me before getting arrested. And I tried to get into treatment. It's hard for drug addicts and alcoholics to seek treatment. And I actually appreciate the dissenting view of the opposition, right, the minority opinion. It's like, why do we need more? And that is the basic principle of capitalism. We have supply and demand. There is a huge demand for beds right now. There is a very little supply. And why? Because it's not profitable. I live in New Lenox, and along Route 30 within like 2 miles, there's like 4 mattress firms. And myself as a property owner, I pay taxes for the tax deferment that they receive to bring the business to town. And I think to myself, now wait a second, I also own businesses. I also pull permits here in Will County. I think my office is waiting on like 2 approvals here. But I think to myself, the reason that there are like 4 mattress firms in that small plaza is because it's profitable, okay? If it weren't, it's a terrible business model, and then they're going to close down. The dissenting view, all right, drug addicts and alcoholics. Alcoholism and drug addiction is not going anywhere. Unfortunately, it's getting worse. And what our communities typically do is we criminalize the act of drug addiction. Because honestly, that's what most people do out of fear. Because of the unknown, we criminalize it thinking that it's going to stop the problem. And then you see this huge influx now of like criminal behavior, but it's mainly based off of drug addiction and alcoholism. And most people say, you know, when you see the person on Jefferson and Larkin, you say, why don't they get help? Where are you going to get help? Unfortunately, it's not existent. It's not enough. And when you have the wait times of like 3 to 4 weeks waiting for a bed, drug addicts and alcoholics have what's called a gift of desperation. And that window is very small. If the opportunity for help is greater, then that means that that window doesn't have to be 3 to 4 weeks long, right? We get people in, and okay, what about the people that don't make it? And we're not going off of success rates, we're going off of opportunity, period. Any one of us could walk out of here and die tomorrow, but like it wouldn't mean that we still don't live today. Like it's not going to happen. Opportunity is all that I believe Dr. Sharma is asking. I haven't personally been through his facility, but I have seen the direct result in those in the community of like the help that he is offering. Honestly, this should be like a rubber stamp process, because anybody that is willing to do what he is doing,
I mean, we should be like welcoming them in with open arms. And you want to open up a facility and pour your money into the community, for sure, man. New Lenox has like vacant lots that, you know, could totally use treatment centers. I get it. Property values and stuff going down. I don't know, man. It's like if you don't want treatment facilities in your community, the drug addicts and alcoholics that are not only in our community but in our family will not have a place to go. I believe that there are more than their fair share of people in here that either have directly suffered from drug addiction and alcoholism or their close relatives have. It should never be, why didn't you get help? Because there was no beds available. It should always be, man, we need to find more drug addicts and alcoholics. We have empty beds. That'll never be a real problem. That's all I have. Thank you.
Hello, my name is Connie DeWall. I took my badge off. I am a Will County employee also, but I took my badge off because I'm a Joliet resident. I've been a Joliet resident for 20 years. My house is not too far from Stepping Stones Treatment Center, where I worked for 10 years. I moved from Arizona in 2003. I'm a wife of 36 years, and I never thought in my life I would say I'm a recovering alcoholic and drug addict. Never moving here from Arizona, I would think this is where I'm going to be. And I think Tom and a lot of the gentlemen that spoke today that I know personally, that I've seen them grow, I've seen them stumble and struggle, but I've also seen them recover. I know Dr. Sharma, we did a program together for our Recovery Coach program. We have two programs out of the county, our Recovery Coach program and our Rapid Response. I believe you saw Angela. We are the Got Naloxone. We hand out naloxone, and I'm not a public speaker. But the gentleman who talked about his home, I kind of reflected on that because I've been in this Joliet for 20 years. I come from Scottsdale, Arizona. It was a culture shock, right, to come from Scottsdale to Joliet, but this has been my home. I raised my children, and I'm passionate about Will County and this community. Very passionate. I want to thank Garland. I want to thank Jennifer. I want to thank Will County Workforce because they're doing the community service project for collecting toiletries for our sober living homes, which Doc Sharma does have sober living homes, and we'll be contributing to that. But when the man spoke about his home and his loss, I thought, he's not going to lose anything. The building on Richards is beautiful. It's beautiful. I'm sure the building that's going to be created, I know people who are painting in that, who are in recovery, who are painting it and structuring it. It's going to be beautiful. And the reason I know it's going to be beautiful is because lives are going to be saved from that. I have 3 children, 31, 25, and 24. My 24-year-old just bought a condo. He is nothing like his mother. Nothing. My children do not suffer from substance use disorder because I had a foundation to share with them. I broke the cycle. The stigma needs to be broken. And what that man talked about, the stigma, he mentioned it. He mentioned stigma. How do we do that? By denying a treatment center? That's not breaking the stigma. That's creating more. But my appreciation goes to the county for giving me a job, for showing that substance use disorder is a disease and it needs to be treated. And I'm grateful for this county for giving me an opportunity to continue with that, to continue with our grants and to keep moving forward. And I implore the board to please say yes to Dr. Sharma. Thank you.
Hi, my name is Katie Hollingsworth. I had not planned to speak today, so I have nothing prepared, so please bear with me. But I just felt compelled to take advantage of the opportunity. I'm really speaking on my son's behalf. He's not here to talk today because he's sitting in a jail cell at Will County Jail right now. Last year about this time, he was ready to go to treatment. He made phone calls. He called probably 6 different treatment centers. He did 4 different assessments. Nobody could take him. They either didn't have beds available, or he wasn't sick enough, or he was too sick, or they didn't want to take his Medicaid. He was put on wait lists. He was told, call every other day, call next week, call next month. For 3 months, he waited for a bed. He overdosed twice in those 3 months, and finally, by the grace of God, he survived those overdoses and he got arrested. And he's been sitting in Will County Jail cell for 7.5 months, waiting probably to go to prison. I guess he is considered a failure. He's not one of the success stories. And this is what happens when we don't have enough resources available for our loved ones. It shouldn't be this hard. It doesn't have to be this hard. I don't know Dr. Sharma. I've never met Dr. Sharma, but I would love to one day. But I do know that he is saving lives. And I hope that one day my son is lucky enough to have the opportunity to have somebody like him help him. So please, I compel you to please vote yes for Dr. Sharma's plan. Thank you.
Hi, good morning. I'm Xenia E. Garrity. To all the county board members of Will, I moved to Will County to fight my disease of alcoholism. I have now been in sustained remission since May 7th, 2017, with the help of many agencies that specialize in the treatment of addictions and mental health. I didn't have money or private insurance at that time, and I was able to find help with state insurance, Illinois Medicaid. Since the day I made that change in my life, I have aggressively gotten into the field of helping people of all color, ages, and afflictions. I have worked at local treatment center, passed out Narcan on the streets in our community, and educated. I am currently an intern at Salvation Army, where there are more and more homeless addicts and mental health consumers walking through the doors looking for help and nowhere to go. With COVID, that number has doubled. I consider Will County to be the place where people have started new lives. Some people stay here after completing treatment, completing a sentence, and heard that we have the best and largest community, recovery community in the state of Illinois. I'm not sure if that is true or not, but there is a large network of people that I feel have changed this county for the better. I have had the pleasure of working with many recovery coaches that have found treatment in this county and recovery. Unfortunately, there is not enough treatment centers that offer what I think is essential to recovery, and that is a center that offers dual diagnosis treatment. The only facility that offers that is ECS, and where we have these two facilities, that is not enough. We need more facilities, and it makes sense that ECS to offer this service where they have a model that works and is available to all that seek it. We have a real problem that is afflicting our community, and where I can't change the world, I can help change the community that I live in. The rise of addiction is impacting every city and every state. Let's be the change and give our community hope in battling this epidemic. Instead of drug dealers on every corner, how about a place where our civilians can find hope and help? And ECS can be one of those places. The other day when I was at Salvation Army, I was just there and we were preparing for a women's conference, and we were just doing karaoke to lift up our spirits and get ready for that. A young man walked in, and his mind was not there. He was hopeless. He was helpless. And I said to him, what happened? And he goes, I made a mistake. I left ECS. And he sat down and he heard everybody sing. And then I said, honey, you got to get your bags. It's time to go. Where are you going to, what are you waiting for? Because I thought he was waiting for a ride. And he said, I'm waiting for my life to come and start. Luckily for me, I'm part of this big recovery community here. And my husband, I hope he'll be my husband one day, called Tommy Ledwell. And Tommy Ledwell called Dr. Sharma. And that young man that had nowhere to go, Dr. Sharma took him that night. And I was just amazed. I was impressed. And I said to myself, you know, God is good all the time. I implore you, you know, I came here all the way from California to get sober. And I've stayed here. I've been in nonprofit agencies since I was 15 years old, fighting for different political things. When I became an alcoholic, I did not know that that could happen to me through a gastric bypass. and I changed my addiction from eating to drinking, unknowingly that I would become an alcoholic. And here's where I found treatment. Here's where I stayed. Here's where I get involved. Here's where the change is. We are a great county, and we have a lot to offer. And I say, let's open up another treatment center, and let's start creating more people like me and all the others before me. Thank you.
Hi, my name is Christina Powers. I did not set anything up, so I'm going to shoot from the hip. I work for Will County Substance Use Program with Connie and with a few of our other team members here. My sober date is June 2nd, 2020. And I say that I'm very proud of that date. Thank you. I was a hopeless alcoholic and drug addict. My parents had thought that they were going to bury me. I had went through lots of treatment centers, right? And I had to wait lots and lots and lots and make these phone calls like a lot of people had said, right? I got arrested one time, which was like 3 days before I was supposed to actually get into treatment, which I was waiting to get into for 6 months. And it was there that I had learned that there was a different recovery center for me to go to. And that was the one that I ended up staying at, right? I work in the field today, and I'm super blessed to be able to do that today. I'm grateful that I get to work with these amazing people. I moved to Joliet because of the recovery community out here. There's just so much out here for people that were as hopeless and desperate as I was to get the recovery that they wanted and the support that they needed. I have never been to ECS. I am a female, so unfortunately I've never been able to go through that treatment center, but I have heard great things about it. Working in this field, right, I have clients that call me that are, like a lot of us have already said, desperate, right? We only get that little bit of desperation before the mind changes, right? And I have a problem today getting people into treatment, right? I actually have one of my really good friends that went through ECS, right? And was a success story, right? And he ended up having an issue, right? But Doc didn't turn his back on him. The second that a bed was open and he was out of the hospital, I picked him up from the hospital. I was able to take him there. He gives opportunities to people that most actually just shut the door on. I know from experience that the wait lists at all of these places are through the roof. And like one of our other friends had said, private insurance, corporate insurance, all of these different types of things and like hoops that you have to jump through. It is intense. And for somebody who is suffering from this disease of addiction and alcoholism, it is hard to make those phone calls and to sit on the phone and do these assessments and then wait 3 months to possibly maybe get a bed if you're still alive by then. And to have another treatment center in our community, it doesn't matter where it's at, Joliet, New Lenox, wherever, a treatment center is going to only bring a chance for someone to live. And I'm super grateful for people like Doc because I have the opportunity today to be able to give back, right? Like I didn't have that. I never knew what this was. I never thought that I'd ever be able to live this life, right? I live a life today outside my wildest dreams. And it's only because of people like him that put treatment centers like that together and have these beds to offer people. And I just hope that you guys support this and vote yes. That's it.
So before you start, we have two more speakers, and then we have to read emails in the record as well. And I am going to tell you this: I know we have a couple members who are going to have to leave, and this requires a minimum number. So we are going to have to you have to read quickly, speaker, and after these two, then we'll be able to vote.
Hello, everybody. My name is Guillermina Cora, and I am a mom. I'm a stay-home mom, and I would have come earlier, but the line was really long, and I have back problems. So I waited. I just wanted to say addiction is ugly. Addiction is ugly and brings the ugliest things of human beings, but recovery is beautiful. Recovery is hope. Recovery is a start of a new life. I submitted my letter, and I wanted to briefly read it because I know everybody's probably hungry. Respectable board members, my father won the lottery and also became an alcoholic. Late in his life, he started cocaine and ended homeless. I had the privilege to go to private schools. I had a driver, and we ended living at my brother's house because he spent all his money on drugs. At that time, I was very young, and I thought he was a weak man with poor will and a poor spirit. He was not responsible for his family. He preferred enjoying his life than supporting his family and putting her daughter to college. My father did not attend my wedding because he couldn't stop drinking on that day. I got married, and I had my own kids. I talked to them about mental health and addiction. I live in an affluent part of the city, and I was involved. PTA, you name it, field trips, taking the kids to fun places. Nevertheless, my eldest son started consuming drugs at a very young age. It was a nightmare. Why me? Why again? What did I do wrong? I didn't understand until I started joining a support group, which I'm proudly part of. That addiction is a disease, it's a sickness. It affects your brain. It hurts your willpower. You have no control. And in order to come out of that, you need help. You can't do it alone. We need facilities that provide that help for those who struggle with drugs. And we also need those facilities for their families members so that we can be educated, we can get guidance, and also we can all learn how to heal. My father went from a wealthy person to a homeless man. Existential is there to provide help for all who are in need, regardless of their financial or social status. Dr. Sharma accepts the most under-resourced men. He takes state insurance, Medicaid, and very few facilities accept those who don't have a great PPO insurance or aren't wealthy enough to pay thousands and thousands of dollars on cash. Addiction does not discriminate. It affects all, rich and poor, but it's harder for those impoverished to find help. And addiction does that. It takes the money away from a man that won the lottery and already had a prosperous business to become homeless. That's what addiction does. Addiction is ugly. We don't want it in our neighborhoods, but we want the hope that facilities like Existential does. I have a question for the board members. What if it was your father who needed a rehab? What if it was your son who is struggling with drugs? What if it was a family member that needed help from his addiction? Can you imagine the anguish in waiting for a bed to be open at a facility? We're talking about life and death. This is a subject that seems far away, and it's ugly, and we don't want to talk about it until it hits home, until it's your son, your father, your husband. Addiction does not discriminate. We are in a crisis. I am here to share my story and part of it, and to request your support. Please vote yes. We need more inpatient rehabilitation centers like existential counselors. Please think about your vote today and about your families. Thank you.
Hi, everybody. My name's Pat Finnegan. I'm an alcoholic. Can you hear me? Because I like to say I'm a member of the CIA. It was a Catholic Irish Alcoholics. I took my training in on the south side of Chicago, 35th near 35th and Ashland, by Wrigley Gum and all those big factories. Everybody that lived in the neighborhood worked in the factory. Everybody that lived in the neighborhood drank at Shaky Jake's, and I was 15 years old when the White Sox won the pennant, and I was sitting at Shaky Jake's with my dad drinking beer at 15 years old. So I've been around alcohol for a long, long time. In 1979, I quit drinking. I'm sorry, 1997. I had been drunk for over 40 years. And today I can say I've been sober for 25 years. Haven't had a drink in 25 years. And the point of me coming up here is to tell you that I did not do it alone. By myself, my sponsors say when I'm by myself, I'm in bad damn company. And it's the truth. When I go inside my head, I'm totally disarmed. I work on a 12-step program, and it's people helping people, and that's why we're here today. The Lord says, one of the apostles said, Jesus, how do I get to heaven? Jesus said, love your neighbors as I have loved you.
Okay, just so you know, if you did sign in and did not speak, your name will be recorded with your position. And now I'm going to turn over to Speaker Cowan, who will read the emails that were sent in. They will not be repeated. If you spoke today, your email will not be read in, but it will be recorded.
Thank you. The first is from Denise Winfrey. Fellow board members, I realize Dr. Sharma has met all requirements of land use and that he successfully operates 2 other such clinics in the area. I am also aware of the growing need for such facilities. People often say not in my backyard, which poses a real hurdle to helping people get services. However, the residents in the area are saying no to a 3rd facility in their backyards. Member Brooks and I have received numerous phone calls and emails requesting we say no. I am not able to attend the meeting. If I were, I would have to vote no on this on behalf of my residents. Denise Winfrey, County Board 8. Shakshi Aurora. Will County board members to whom it may concern, I am writing in support of Existential Counselor Societies and Dr. Bipin Sharma's request to open a drug and alcohol rehabilitation facility in Will County. As someone who has seen addiction up close in friends and family, I feel facilities like ECS are very necessary to our community. Individuals struggling with addiction are fathers, mothers, brothers, sisters, etc., that have family members who are desperate for a solution to help with addiction. ECS provides that solution. Their approach to treatment is unique and allows individuals to get to the root of their addiction with one-on-one therapy. Though the struggle with addiction may be personal for some, we are all aware of the addiction epidemic that is affecting our communities. Without places like ECS providing a solution, we are all fighting a losing battle. For this reason, I humbly request you approve Dr. Sharma's request to open another facility in Will County. Thank you for your consideration, Shakshi Aurora. My name is Byron Bideman, and I'd like to talk to you about my experience getting treatment for substance abuse. There's an ongoing drug epidemic in the country, and opportunities for treatment are too few compared to the need. I experienced this lack of adequate and appropriate treatment firsthand when I sought treatment for my struggles with addiction. At my lowest point, I had lost my job, lost the trust of those closest to me, and come close to losing my entire family. Thankfully, Dr. Sharma was able to take me into this facility when I needed it most. Over the course of 28 days, my thinking changed. My thoughts tended towards the rational rather than the impulsive. I began setting and accomplishing goals, and I am working towards fulfilling my purpose in life. All of these are focal points of the treatment at ECS. By staying connected to the ECS community, I continue to work on myself and contribute what I can back to the guys who need it. Today, I have stable employment, I have love and trust in my family, and my friends look to me as someone they can count on. Most importantly, I have control of my mind. I only wish more people could have the opportunity that I had to go through ECS. Given the imbalance of need and availability of inpatient treatments, I believe the new facility on Chicago Street will serve the overwhelming and increasing problem of drug addiction in our state and community. Please approve this facility so more struggling addicts can have a safe place to begin their recovery. Carla Sija. To whom this concerns, the Inpatient Rehabilitation Center project must be taken into consideration. The drug epidemic that has taken place in our own community needs all of our help and support. We are dealing with something very serious, and most addicts do not know where to go even to start if they do desire to become clean. This project will extend that help and generate great value in our community. Thank you. Kind regards, Carla Sija. Bessie Dotson, complaining about a halfway house. We need a grocery store for the East Side and South End people. Get rid of the liquor store, which is a serious problem. Take it to the West Side. Stop making this a trash dump. Alan Frankowitz, dear Will County board members, I'm writing in support of the inpatient rehabilitation project convening on the May 19th, 9 a.m. for meeting for a vote. I'm writing regarding the importance of having treatment facilities to combat the drug epidemic raging in the nation and especially in Will County. I ask that you vote to approve the rehab facility. Here's a link to the 2021 overdose statistics from Will County, Illinois. I hope that you find the time to review it and help you decide your vote. Here is a link to the CDC National Center of Health Statistics. As of September September 17th, 2021, the number of overdose deaths across the nation surpassed 100,000. Please consider this also. How many more needless deaths resulting from the lack of sufficient resources to combat addiction are we going to lose because of the lack of resources? How many lives are affected by your vote? Think about the victims, family, and friends. Think about the good for society. You all know what you need to do. I encourage you to do it. It's the right thing to do. Vote for the rehab facility, please. Finally, how many of us know someone, if not us directly, who has been impacted by addiction? Sincerely, Alan Frankowitz, 34353 Lakeside Terrace, Wilmington. From Dina Gooch. The chance to give opportunity to those who are less likely to receive the adequate help and support they need in order to live their lives, the desire is left to the decision of this board. However, it is with great hope that this group of individuals who have picked to serve and do better for those within their community, that their eyes have been opened to see that the systems in place have been broken and have remained in repeated cycles of insanity. By its very definition, insanity would suggest that instead of attempting to change, we continue to ignore the need for change, ignore the need for society to act as a whole rather than every man for himself. Continuing to intervene in the same manner and conduct businesses in the same way has garnered some of the same responses here in Will County. Increased arrest rates, increased deaths, and increased homelessness for those who specifically have an illness. Substance use is an illness that without adequate assistance, it will remain much like that of any other medical diagnosis when an organ in one's body goes without treatment. Kidney disease leads to dialysis to sustain one's body. People did not choose to have failing kidneys, but who is to say of what they put into their bodies did not add to the failure of this bodily organ? The brain is the bodily organ that is affected by substance abuse. It becomes dependent on those substances to operate in a way that makes sense without treatment. Well, much like failing kidneys, the only ending is usually death. In Will County, we have seen a rise in drug overdoses. The number may feel small to those not directly impacted, but what about the mothers who lost children who were their whole world? Is that a small loss? How do we as humans put value on the lives of people based on our own personal biases? All behavior is a form of communication. What does that behavior say to people who struggle with things like drugs? Why does the behavior of someone who's addicted to drugs automatically say they have no worth? Is that the message that is to be received? Because that is what appears to be delivered when we refuse to change our societal supports for those struggling. Will County is in need of rehabilitation center for men as well as women. These men and women deserve a chance to live here in recovery in a facility that takes state insurance. Please show your support. Dr. Sharma serves a population of men who have limited resources, which means limited choices for treatment. There are few facilities that will accept state insurance. Some statistics from the Will County website. 2021 overdose deaths in Will County was 150. 111 of the 150 overdose deaths were from heroin fentanyl, 74% from heroin fentanyl. As of April 28th, 2022, there have been 34 overdose deaths. 28 were from heroin fentanyl. That's 184 overdoses in 16 months. We need to do better. Let's start by offering Dr. Sharma a chance to pave the way to a better society instead of continuing on as we have been for many years. Thank you for the time you took to read this, with great hope that small system change opportunities like this one will make the shifts necessary to bring Will County more hope and less despair. Best regards, Dina Gooch, MS, BCBA. Michael Haney. To whom it may concern, my name is Michael Haney. If this was not for a facility like ECS and the staff there, I would not be able to say that I currently have a year and 2 months of sober from heroin. I've been struggling with addiction for years until this point, been to multiple treatment facilities, jails, and hospitals. I can proudly say there is no other place like this. With the high rate of addiction and deaths that's been going on lately and in this area, I believe it would be highly help the community and addicts. I personally know the staff and owner, and they've always been there for me through bad times and the good times. If it were not for Dr. Sharma and his facility, I do believe I would have been deceased by now with the rate of my addiction was going. So please allow them to reach out and help more. And thank you for listening to me. Sincerely, Michael Haney. Tamara Henning. I am writing in support of Dr. Sharma's plan to open a third ECS center in Will County. There is not enough available services to vulnerable members of our community. As the number of overdose deaths in our county continues to rise, we must respond accordingly and welcome this effort to provide critical life-saving services to community members who will suffer from substance use disorders. Will County needs to have more options to help those in need. As a community, we must do better. I ask you to please show compassion for those who are suffering, the people who love them, by allowing Dr. Sharma to move forward with his plan. Thank you. Jennifer Kubelka. This letter is to express my support for the continuing expansion on mental health treatment facilities. As our whole medical system has reduced the amount of treatment facilities for those looking to assistance with their mental health and addiction recovery. Unfortunately, a majority of population affected are the impoverished and underserved population. In the last several years, we have seen the need for assistance with mental health and addiction steadily increase with the presence of COVID. I write this letter in support of the expansion of mental health facilities in an effort to provide assistance for those with mental health needs and addiction while providing support to the community. Jennifer Kubelka, nurse family practitioner, MSN, RN, CMSRN. Julie McCabe Stir. I am writing in support of the ECS's efforts to establish an inpatient addiction treatment center at the 2019 Chicago Street in Joliet Township. As the retired problem-solving coordinator for State's Attorney Jim Glasgow and the 12th Judicial Circuit, I am well aware of the need for inpatient treatment beds, especially for the indigent. The wait list for treatment is often long and frustrating for those struggling with addiction and coming to the realization that they need help. Dr. Bipin Sharma and his staff offer a unique approach to inpatient treatment in a one-size-does-not-fit-all field. His proven success at the 2 existing facilities in the community shows commitment, compassion, and desire to improve our community one life, one family at a time. Please consider his request and approve the opening of this new facility to serve clients living in our community. Alex Milosh. My name is Alex Milosh. I was a client at ECS1 in July of 2021. Before coming to ECS, I was broken. I was lost. I had nothing left inside, coming to the point of wanting to take my life. Before coming to treatment at ECS, I went to countless rehabs, sober homes, meetings, and detoxes. I was homeless and had broken every relationship in my life apart. My family wanted nothing to do with me. I couldn't stop relapsing and felt I had no hope. Coming into ECS, I learned things I've never learned before about this addiction. Other rehabs just sat me in a group for 10 hours a day, and I barely saw a counselor. ECS helped me to look really deeply within myself and take a look at my traumas, my thought process, purpose, relationships to attachment with my family, and how I was codependent. And then after the groups, ECS really gave me time to process this information and talk to a counselor one-on-one about it all. It is an amazing treatment center that changed my life. I gained connections with others that I call my best friends today. I'm a proud alumni member and love how we have the opportunity to come and speak to the guys in treatment and help out the guys who are just coming into treatment. There's a shortage of treatments like this in the area, and I feel it would benefit the community greatly for ECS 3 to be open. There's a lot of work behind the lines in this battle with addiction. We all need to help, and we all need the help we can get, and ECS would definitely make an impact. Jeffrey Petsky. We are writing to express support for the men's facility. Our son Jeffrey struggles with addiction and mental health. He's recently at rehab getting the help he needs and deserves. Jeffrey has support and love from his parents and family, but our love and support is not enough for the extensive professional help he needs. Rehab centers have been essential in giving our son hope and tools needed to have a positive, clean life. Facilities like this take the burden off hospitals, shelters, and the possibility of being homeless. These men have a better chance to reclaim their lives with expert help. Thank you, Jeff and Ruth Petsky. Ralph Prankus. My name is Ralph Prankus, and I've been a resident of Will County for 36 years. My reason for the email is to urge the board to allow a 3rd ECS rehabilitation center in Joliet. On April 3rd, 2020, my son Peter told me he was going to get treatment for his opioid addiction. Unfortunately, he never made it to treatment. On April 6, 2020, my son was found dead from an accidental fentanyl overdose. Our society bombards us with addictive enticements, cannabis dispensaries, riverboat casinos, big pharma opioids, slot machines, liquor, lottery, virtually everywhere. Not to mention the COVID-driven isolation impact over the last few years. However, accompanying effective addiction treatment centers are sorely lacking. The U.S. Department of Health and Human Services lists evidence-based treatment as the best strategy to combat substance use disorder. The crisis will only worsen if left unaddressed. I urge the board to do the right thing and improve the ECS rehabilitation facility. Jackie Preeb. I am writing to support Dr. Sharma and his plan to open a 3rd ECS center in Will County. I know firsthand when someone is in need of treatment is ready, it is so very important that a bed be available immediately. If a bed isn't found quickly, someone with a substance use disorder will go back out and use, many times resulting in an overdose death. I'm involved with several support groups. My heart has been broken so many times because someone I know, I love, and care about has died from an overdose. It is devastating to a family. Unfortunately, in Will County, there aren't enough beds for those needing help. By the middle of April this year, there were 32 overdose deaths in Will County. In 2021, there are 111 overdose deaths in Will County. There's a great need for treatment in this area. Many people don't realize that those suffering from substance use disorder are good, intelligent, gifted people. Those I know that we have lost to overdose deaths were honor students, college graduates, gifted musicians, talented athletes. They were involved in church and in scouts. Addiction doesn't care how good a person is. Our world has lost too many people that have and would have continued to do good things. My daughter suffered for many years with substance use disorder. Fortunately, she was able to get treatment quickly due to our insurance. She is no longer using drugs and has been in recovery for 5 years. She is now a successful business owner and owns her own home. Without treatment, we would have lost her. Sadly, so many others don't have the insurance to get help, which limits where they can go for treatment. Existential is a place they can go to. One of the most important parts of treatment is one-on-one therapy. Most treatment centers don't do enough to help with this. They have a client see a therapist 1 day a week for an hour. Dr. Sharma provides each client with at least 4 days a week, an hour a day with a therapist. It makes a big difference. Please help the people of Will County in treatment with their families by allowing Dr. Sharma to move forward with his plan to open another treatment center. Jesse Rose, I write this letter to you in reference to the meeting that will take place today seeking approval for a new inpatient addiction treatment facility. While I recognize that we still unfortunately live in a time where stigma stigma can impede the critical access to help so many in our community need. I hope this letter finds you open-minded and in recognition of the current crisis we currently face. In a time when most America's focus was on the pandemic, we lost sight of another epidemic, one that killed 107,000 Americans last year, over 30% more than the year before, and we are on track to continue to climb. The uncertainty of the present and future, the financial stress so many are under, and the isolation and fear that has been such a large part of the last few years has increased the addiction population, with so many turning to drugs and alcohol to cope, only to have it spin out of control. It is well established that there are people who can simply stop on their own somehow. Most cannot. Places where they can receive clinical support they need to address their emotional, physical, mental, spiritual, and well-being are so vital to their chance at a better life. One cannot overstate just what a necessary component this is to our community. Addicts are people. They are our brothers and sisters and mothers and fathers and children and friends. Lack of access and too few resources means we lose more of our loved ones every day. If you're not sold on viewing it from the point of view of those struggling, you can surely look at it from the well-being of your town and community. The drained resources, the ambulance rides, the lost productivity at work, the criminal justice system, etc. All of these pillars of community that we support are impacted by a burgeoning addiction crisis. Please think seriously about what we can all do together to bring back hope to those who have lost it, to support those who feel they have been cast aside, and to take this simple yet critical step to heal our community. Octavia Scott. I understand there's a Will County Board. The Will County Board will be voting next Thursday on whether to allow a third halfway house in my community, Sunset Point. My neighbors and I have concerns about this matter, and we ask you to vote no. Instead of another halfway house, we ask that a business that will benefit the community be put in place, something like a restaurant, grocery store, or CVS pharmacy. Also, if something can be done about the liquor store, there have been complaints about the truck and railroad trailers that are being left in the parking lot for extended periods of time. Thank you in advance. Audrey Secco, regarding the proposed rehabilitation center for 2019 Chicago Street, I am opposed to this because Joliet is becoming inundated with several proposed hardship locales that house the homeless, drug addicts, and misplaced persons. Will County isn't just Joliet. It encompasses Bolingbrook, Romeoville, Manhattan, Shanahan, New Lenox, to name a few. Dr. Sharma cites this Chicago Street location as being ideal because of the location with limited neighbors and traffic. Well, did he turn his head as to the current traffic on Route 53 in Chicago Street? The current building isn't even in very good shape and will very much need dollar to maintain, upgrade it to keep it habitable. As stated in the Herald News, there are already similar facilities in operation on Manhattan Road and Richard Street in Joliet. Putting another rehab in Joliet puts more pressure on our current hospitals, police force, firefighters. I want him to explore land and building opportunities in other areas of Will County outside of Joliet. Joliet needs business to bring dollar into the community, not be the caretaker for, in all caps, every hardship case in the county. Please vote no. 205 Crabapple Court, Joliet, Illinois. Bikram Sharma. I'm writing this letter to ask the board to consider the approval of ECS Inpatient Rehabilitation Center. During the pandemic, substance use disorders have become even more prominent, and there's an increased need for well-equipped residential treatment facilities to provide and care for this marginalized population. ECS has demonstrated the propensity to help patients struggling with their addiction and provide them with exceptional services to sustain their recovery. We ask that the board grant permission to help establish this center to better serve the community of Joliet and become another beacon of hope for patients struggling with addiction. Bikram Sharma, a diplomat of the American Board of Psychiatry and Neurology. Sherry Stillwell. I'm writing to support Dr. Bipin Sharma, a ECS petition for a rehabilitation center for men. This would not be a sober house. This would be a small residential 28-day recovery program for 12 men, which includes intensive counseling, group sessions, training, education, and skill enhancement to give the men a hand up towards a new and better life. Dr. Sharma runs a strict program which provides guidance, schedule, support, security, consistency, responsibility, and builds self-esteem. The would-be residents are human beings, sons, fathers, brothers, who all deserve a better chance at life. Treatment can reduce crime, violence, recidivism, and improve the quality of life for the individuals and their families. Will County is in need of a rehabilitation center for men that takes state insurance. Dr. Sharma provides a population of men who have limited resources, which means limited choices for treatment. There are few facilities that will accept state insurance. Substance use disorder has impacted my family, and I believe the opiate pandemic is cause for more opportunities for men to receive help and live in recovery. Addiction doesn't discriminate. It affects people of all backgrounds, genders, ages, all professions, all socioeconomic statuses. Yes, it could affect your family one day. And when that happens, wouldn't you want your loved one to have an opportunity to receive help even if they didn't have a great PPO insurance policy? Here are some statistics from your own website. 2021 overdose deaths in Will County, total 150. 111 of the 150 overdose deaths were from heroin fentanyl. 34 overdose deaths as of April 28th, 2022. 28 were from heroin, fentanyl. Thank you for taking the time to read my message, and thank you for consideration of this matter. I'm writing John Joe Talty. I'm writing today on behalf of Dr. Sharma's pursuit of opening a third treatment center. Let me start by telling you a little about myself. I'm a father, grandfather, son, and uncle. I'm also an alcoholic addict. My addiction does not define who I am today. The reason is simple. I went to ECS. Treatment facilities are in demand. All too often, there are not enough beds to accommodate this pandemic of addiction. I was turned away many times or made to wait weeks for a bed. It is so imperative to help the addict when they are at their bottom. When they seek help, making us wait is dangerous. We become discouraged and figure, what's the use? Many of us die taking one more. ECS saved my life. I am reunited with my family running a business. None of this is possible without treatment. Many find ourselves in jail because of our addiction. With proper treatment, which includes having beds available for the addict who still suffers, is of the most importance. So yes, I believe in change through proper treatment and therapy, which I receive through ECS. Dr. Sharma helped me to be happy, joyous, and free. Today, my life has purpose. Please grant the opening of a third treatment facility. Thank you, John J. Talty. Kelly Tice. Over the past several years, I've attended dozens of funerals for overdose victims. I've talked to broken families who've lost someone to overdose. What I've learned is that families don't just lose their loved one for a single heartbreaking moment in time, they lose the future as well. Think about all of the events and occasions that now will not happen, the wedding that will never be planned, the grandchildren that will never be born, the empty spot at the table for every Christmas, birthday, and anniversary. Every family occasion from now on, grief and pain instead of celebration. These are not just nameless addicts. They are individuals, fathers, brothers, employees, neighbors, friends that impact the community just like you and I do. Fentanyl is now the #1 cause of death for Americans aged 18 to 45. We need more treatment opportunities for this vulnerable population. We need residential treatment, medication-assisted treatment services, and sober living environments to create healthy structures so that individuals can learn a new way to live and become productive citizens of our community. ECS provides the necessary structure to help clients develop healthy lifestyles. Not only are there not many options for residential treatment in this area, most have long waiting lists or only accept private insurance. This means that while they wait for a treatment bed, clients continue using drugs, which leads to their committing crimes, getting arrested, or overdosing. ECS provides unique treatment in that clients are seen by the highest level therapist at least 3 times a week. They use more advanced techniques than other facilities and give each client personalized care that includes trauma therapy, behavior modification, and a solid community of alumni peers in recovery. I urge you to approve the new facility for ECS so that they can reach more people who desperately need help and continue to make a positive impact on the community. Respectfully submitted, Kelly Tice, community member and supporter of those struggling with addiction. Dale Walsh. My name is Dale Walsh, and I was a client at ECS in April 2020. Before coming to ECS, I battled with my addiction for over 20 years. During my addiction, I've been homeless, lost all my relationships, lost confidence in myself, and felt like there was not much else to live for. Coming to ECS not only changed my life, but also saved my life. The treatment and concepts I was able to obtain as my time as a client is how I successfully conduct myself on a daily basis. Today, I'm over 2 years sober and have learned to live and enjoy my life in sobriety. I reside in independent living that ECS helped me attain. I'm involved with the family I once lost, and I'm confident in my abilities to take on all challenges that life throws at me. ECS helped me change my mindset along with helping me work through the challenges that made me go back to my horrible situation. Today, I'm proud to say that I am not only an alumni at ECS, I'm also an employee. I've worked for ECS 1 for the last 2 years. I've seen many clients come and go. I know firsthand that a facility like ECS, along with other like facilities, are much needed in this community. Our community is part of a national epidemic, and more facilities will only help pass along the message that recovery is possible. Recovery is about application, connection, and service. ECS helped me change my mindset and apply my new way of thinking on a daily basis. With this community, I am able to stay connected not only through my employment here, but all of those connections I've made through my experience here. By staying true to my recovery, I am able to give back on a daily basis and help others fighting addiction become sober and continue to live in sobriety. Thank you for the opportunity to speak today. Christopher Wober, we just, 2 more. Third halfway house location is completely unacceptable. The model does not work with the low-income sectors of people barely making ends meet. Even veterans have voiced their opinion. I do not want to get into politics, please. Joe Wood, this is the last one. It has been brought to my attention that the county board will be voting to approve or disapprove the building of a rehabilitation center in Will County. Before you vote, I sincerely hope you can find it in your hearts to think about yourselves and those around us before making a decision. I can only speak for myself, but I personally witnessed friends and family battle addiction. I've seen firsthand destruction it can cause on their life and how important a rehabilitation center and getting the right help was for them. It's extremely important that anybody with an addiction that wants help has a place that they can go to for the help and guidance they need. And by voting yes to approve the building of this center is proof that Will County is not only committed to improving upon its community, but also committed to investing in its citizens and making sure that they have an option to get the help they need and ultimately become active, productive members of society. I really appreciate you taking your time to read my email and your time and attention to a matter that's extremely important to me.
Previous roll, Mueller. We have a motion to close public hearing by Frizzalone, seconded by Cowan. Madam Clerk, please call the roll.
Mueller. Yes. Frizzalone. Yes. Newquist. Yes. Ogalla. Yes. Cook. Yes. Mustis. Mitchell. Yes. Tyson. Yes. Gazanfer. Yes. Trainier. Yes. Gould. Yes. Van Dyne. Yes. Balich. Yes. Brooks. Yes. Parker. Yes. Ventura. Yes. Coleman. Yes. Markham. Yes. Berkowitz. Yes. Pretzel. Yes. Weigel. Yes. Freeman. Yes. Krolitis. Yes. Cowan.
24 affirmative.
24 affirmative. The public hearing is now closed. Chairman Markham.
All right, so the first item is zoning case ZC 22-007. This was tabled last month, so I move to remove this from the table.
Motion by Markham, seconded by Ventura. Previous roll call by Trenier, seconded by Mueller. All in favor?
Aye.
Any opposed? Motion carries.
All right, so for case ZC-22-007, there are two requests. This is a map amendment from C4 to R2, and then a request for a special use permit for inpatient rehabilitation facility, commonly known as 2019 Chicago Street, Joliet, County Board District Number 8. I make the motion to approve the map amendment from C4 to R2. I so move.
Motion by Markham, seconded by Frizzalone. Is any discussion?
Thank you. I watched and listened carefully to those who spoke, but I also watched those who were in the room. Why is it so hard for those of us to hear people's testimonies, their experiences, and their loss? But their successes too. They were very powerful stories. But it is the repetition, not just here in this room, but those of us who have fielded these phone calls. The love and the empathy and the hope that you have shared is powerful too. The truth is that we do not have enough treatment centers in Will County or in the United States. We do not have enough mental health services accessible to all. Our society focuses too much on money and status and not on hope and empathy. This is such an amazing opportunity for Will County to be a part of the solution, to put people first. I want to thank everyone who shared your story. It is brave and courageous. My family has similar stories that I will spare today. I see you and I feel you. I have questions for my colleagues. Have you ever fielded a phone call from a constituent who says, my father is addicted to opioids and I need help. What do I do? And if you've received this phone call and you've talked to Kathleen Burke or some of the other members like NAMI and Stepping Stones, and after researching the few places that individuals can go, mostly with insurance, did you then follow up with a constituent to see, were they placed in the facility? Did they get the help they needed? I have fielded too many of these calls, and I have talked to too many residents who are struggling, their family members are struggling. I have spoke to the homeless. I have spoke to people who have lost their loved ones. And for anyone in this room who has taken those phone calls and spoke to those residents, you know that our resources are not enough. So the real question is, do you want people with addictions living on our streets, in our shelters, in our jails, and in our hospitals? Or do you want them in recovery, working jobs, buying homes, spending time with their families? One robs from our community and the other one helps to invest it. Therefore, I am proud to vote yes and encourage every board member in this room to vote yes. Thank you.
County Board Member Brooks.
Good afternoon, Madam Executive. Ladies and gentlemen, as many of you all know, this facility is located in my district. And I want you to know that my office is a half mile north of where this facility is located. I have been the pastor there for 32 years and have dedicated my life to a lot of things that is spoken of today. However, I must let you know that not only was I inundated with calls, emails, and the letter that was held up. In fact, somebody even chose to put it on my car and brought it in and tried to pass it out in my church. But the reason why I turned my microphone on, because when I met Dr. Sharma, not only did I see his vision and what he wanted to do, but I met a friend, and I admired the work he wants to do. But I also want to let you know that I serve on the board of directors of Stepping Stones, and he and I have some of the same passions. However, I must let you all know that the reason why I am going to abstain from this vote on today, because I do feel the passion of everybody that came here, and I also recognize and hear the voices of those that I represent. And lastly, I'll turn my mic off by telling you this. There are many recovery groups and rehab that meet at my church. On tomorrow, they're having a mini convention at my church, and they're selling fish dinners. What do I get out of that? I'm so glad you asked, Jennifer. What I get out of it, I see money raised to help many people, like the testimonies on today. But also, I get a free fish dinner with extra cake. Thank you, and that's why I'll be voting abstain. Thank you.
Go.
Thanks. Just wanted to apologize for reading the public comment question quickly. We have board members who need to leave, and I know they want an opportunity to vote on that. So I would just ask any other board members who have comments. I don't think we're changing anybody's mind right now, and we need to get to this vote. So if you can hold your comment, if you're willing to hold your comment till the end of the meeting, that would be awesome. Thank you.
Well, they should be able to speak before they take the vote. So there was only one other speaker. Do you want to speak on behalf? Okay, yeah, sorry. Yeah.
Okay, maybe 5. Oh.
Go ahead, go ahead. Go ahead.
Take the vote.
Raquel, go ahead.
I'm willing to wait. I'm willing to wait. Never mind.
It's fine.
You can talk now.
Yeah. We are in the board, but you're fine.
All right. I'm sorry. I said I could wait. So, all right. So all I wanted to say was that some of my colleagues on the board supported legalizing cannabis. I absolutely hate it. I hate it as much as I hate alcohol abuse, drug abuse. I hate it all. And I want to let you know that I feel for all of you who came up here. And that's really all I wanted to say. I'll be voting with my colleagues to allow this. And I want to also say that I understand the issues that the neighborhood has. I want one in every neighborhood, but one in every neighborhood, and one in every. This neighborhood is, their issue is that there are 3. So I do understand that, but I will be voting for the other. That's it.
Thank you. Madam Clerk, we had a first and a second. Madam Clerk, please call the roll.
Mueller. Yes. Frizzalone. Yes. Newquist. Yes. Ogalla. Yes. Cook. Mustis. Yes. Mitchell. Yes. Tyson. Yes. Gazanfer. Yes. Trainier. Yes. And I'm doing that in honor of my son, who lost to his son. Gould. Yes. Van Dyne. Yes. Balich. Yes. Brooks. Abstain. Parker. Yes. Ventura. Yes. Coleman. Abstain. Markham. Yes.
Berkowitz. Pretzel. Weigel. Freeman. Krolitis. Cowan.
21 affirmative, 2 abstention.
With 21 voting in favor, the motion carries. County Board Member Markham.
All righty, so next up for the same zoning case is the request for the approval of a special use permit for the inpatient rehabilitation facility with 3 conditions, and I move to approve.
Motion by Markham, seconded by Ventura. Previous roll call by Mustis, seconded by Frizzalone. All in favor?
Aye.
Any? Oh, is anyone who abstained want to? Okay, I'm sorry.
Yes, yes for both.
Herbert Brooks is changing his votes as well as Natalie Coleman. Okay, thank you. With 23 members voting in favor, the motion carries.
All righty, next up is number 2, which is zoning case ZC-21-102. This is a request for a variance for a wireless telecommunications tower height from 200 feet to 259 feet. This is in Jackson Township, commonly known as 25945 Chicago Road, Elwood, Illinois, County Board number 6, and I move to approve the variance.
Motion by Markham, seconded by Brooks. Previous roll call by Trinier, seconded by Freeman. All in favor?
Aye.
Any opposed? The motion carries.
All right, number 3, we have zoning case ZC-21-016. This application has been withdrawn by the applicant, so I move to remove this from the agenda.
Motion by Markham, seconded by Frizzalone. Previous roll call by Cowan, seconded by, oh, sorry, hold on, sorry, I got ahead of myself. County Board Member Mustis.
Yeah, I just have a question, and I know that normally we honor when an applicant is requested to have something removed, but they generally have a reason, such as they want to talk to the neighbors, or they need to get more information, or whatever. So what's the reason? Because if the reason is I don't think I have the votes and I'm just pulling it off, I don't know if that's a valid reason. I mean, I know that we don't have any criteria for that outside of us honoring the request, but maybe going forward, we should have some type of criteria why an applicant pulls their case off the agenda for no apparent reason. I think there should be a reason, and perhaps a good reason, for an applicant pulling off when it's gotten to the point where it's already on the county board agenda. So that's just a comment I want to make.
They withdrew their application. It wasn't just to remove it from the agenda. They just took their application away, so it's a moot point.
That's a good reason.
Yeah, so I mean.
I just want to know the reason. They withdrew the whole case.
Sorry, I wasn't clear that it wasn't to remove it from the agenda just to remove it. It was because they withdrew their application.
Good reason. Thank you. Thank you.
So
Mr. Markham.
Did we vote on that already? Are we good?
Oh, we did not. I'm ready to move. Okay, so we have a motion by Markham, second by Frizzalone. Previous roll call by Ventura, seconded by Freeman. All in favor?
Aye.
Any opposed? The motion carries.
All right, next up, we have zoning case ZC-21-017. This is a request for a special use permit for keeping of swine with 4 conditions. This takes place in Crete Township, commonly known as 27007 South Juniper Drive, Crete, Illinois, County Board District Number 1, and I move to approve the special use permit.
Motion by Markham, seconded by Ogala. Previous roll call by Mooses, seconded by Bailage. All in favor?
Aye.
Any opposed? Motion carries.
All right, number 5, we have zoning case ZC-22-003. This is a request for a special use permit for construction sales and services with 3 conditions. This is in Monee Township, commonly known as 2406 Offner Road, Beecher, Illinois, County Board District Number 1, and I move to approve the special use permit.
Motion by Markham, seconded by Gonzapher. Is there previous roll? Previous roll by Newquist, seconded by Ogala. All in favor?
Wait,
Any opposed?
Judy has something to say.
Oh,
I
I'm
think.
sorry. Okay, Madam Clerk, please call the roll.
I was just going to comment. Residents in my area do not want this to happen, so I am supporting them with a no vote. That's what I wanted to say.
Madam Clerk, please call the roll.
Mueller.
Yes.
Frizalone. Newquist. Ogala. Cook. Oh, sorry, she's not here. Mustis. Mitchell. Tyson. Gazanfer. Trainier. Gould. Van Dyne. Balich. Brooks. Parker. Ventura. Coleman. Markham.
Yes.
Berkowitz. Pretzel. Weigel. Freeman. Crolitis. Cowan.
Twenty affirmative, one negative, two negative, one abstention.
We have 20 members voted in favor. The motion carries.
All right, next up, we have number 6, which is zoning case ZC-22-008. This is the request for a special use permit for the keeping of farm animals with 6 conditions. This takes place in Manhattan Township, commonly known as 23913 South Island Drive, Manhattan, Illinois, County Board District Number 2, and I move to approve the special use permit.
Motion by Markham, seconded by Gonzfer. Any discussion? Madam Clerk, please call the roll. Oh, I'm sorry. Slow down. Go ahead. Sorry about that.
Yeah, I know we're all anxious to get this moving along.
I'm here all
I have to
day.
leave by 1 o'clock. But I just want to say on this particular, not just here, and this happens to be my district, but I think it's a bad idea to increase the number of farm animals on zonings that aren't for farm animals. Because my experience has been, it always becomes a problem. And it goes from 1 to 3, but then it goes to 4 or 5. Oh, they're just pigs or they're goats or whatever. You know, I feel it always becomes a problem. And for those of you who've been around for a while, you know it becomes a problem. And it's not a good idea. You know, I suppose there's always been some exception where you might have somebody with a really large lot that has this, you know, zoning that doesn't. But I'm going to vote no on this. Not only for this one, I'll vote no for everyone that comes across our desk or across our board. It's not a good idea. So I'll be a no vote. I'm hopeful that many of you are understanding what I'm saying. Let's avoid problems down the line. And so that's it. Thank you.
Thank you. County Board Member Berkowitz.
For land use. So this is slightly over 1 acre, or 1 1/3 acre, and they want 3 horses. You need some footage for the home, driveway, any barn or storage area they have. And you also have the septic, well and septic. I'm just wondering if land use can make a comment as to, I have a lot of concerns about having the appropriate amount of space. You have to make sure you don't impact your drain field. A septic system is something very important to the health of the residents and the surrounding community. And I'm wondering how much space is left for these animals to really be exercised properly. This seems extremely dense to me.
Thank you. My name is Marguerite Kenny. I'm with the Will County Land Use Department. To answer County Board Members Berkowitz's questions, the property is about 1.37 acres. The applicant requested up to 3 animal units. They are proposing up to 2 horses, so they downsized, but they kept the 3 animal units to allow for other permitted animals. So if they wanted to keep chickens, that would fall into their calculation for animal units. But in terms of the size of the property, they would be looking to use the rear of the property. It would be less than an acre for the horses to roam around in terms of that. They were approved for accessory building area for a variance to allow for a stable to be built on the property while they also have their attached garage, and I believe they may have another shed on the property for personal storage items.
Drain field, septic, and the house, there's a whole acre left?
It's probably going to be less than an acre.
That's how much less? This just doesn't seem to me that there's enough land here. And horses are huge animals. I mean, you say 3 animals, but you compare 3 dogs to 3 horses or even 2 horses, that's an incredible size of an animal.
Yeah, in terms of keeping separation distance, I do believe the septic field is in the backyard. The stable would not be located in that area, but the horses could potentially pasture over the septic field if needed.
They need the podium back on.
Thank you, Madam Executive. So in terms of the waste management, they would have to adhere to the county's waste management plan. It is one of the requirements of the zoning ordinance.
Julie, you satisfied?
Yes, thank you, Marguerite.
There's no more discussion. We have a first and a second. Madam Clerk, would you take the roll?
Mueller? Yes. Frizzalone? No. Newquist? Yes. Ogalla? No. Mustis? No. Mitchell? No. Tyson? Yes. Gazanfer? Yes. Trainier? Yes. Gould? No. Van Dyne? No. Balich? Yes. Brooks? Parker? No. Ventura? Yes. Coleman? No. Markham?
Yes.
Berkowitz? No. Pretzel? No. Weigel? Yes. Freeman? No. Krolitis? No. Cowan?
With 10 affirmative, 13 negative, the motion fails.
That concludes land use and development for today. Thank you all for being patient with us. Our next meeting is scheduled for June 14th, 10:30 a.m.
Thank you. County Board Member Trainier.
Good afternoon, everyone. I have a report to place on file from the Illinois Department of Revenue showing sales tax remitted to the Will County for the month of February 2022 to be $2,010,616.72, and the RTA tax received is $2,398,984.24 for a total of $4,409,696. And let's hope I can get back to my agenda. Do I need a motion? And I so move.
Mueller. Frizalone. Newquist. Ogella. Mustis. Mitchell. Tyson. Gazanfer. Trainier.
Yes.
Gould. Van Dyne. Balich. Brooks. Parker. Ventura. Coleman. Markham. Berkowitz. Pretzel. Weigel. Freeman. Curlitis. Cowan.
21 affirmative, the motion carries.
Next, I have item 22-111, committing funds for the University of Illinois Cooperative Extension, and I am proud to report that at the committee, we voted to increase their request. So I move that we support the request for $75,000.
Motion by Trenier, seconded by Frizalone. Previous roll call by Mustis, seconded by Brooks. All in favor? Aye. Any opposed? Natalie, would you like to vote yes on the extension to University of Illinois Cooperative? Yes. Okay. Thank you.
Next item up, 22-1, oh, do you need to read the total? Sorry.
No, we're all good. We're all good, thank you.
Next item up, 22-112, identifying funding for vehicle purchase for the coroner's office, and I so move.
Motion by Trenier, seconded by Ganfer, previous roll call, but you know what, I'm just gonna do a roll call because we need to clear when people are going in, going in and out now. So Madam Clerk, please call the roll.
Mueller. Frizalone. Newquist. Ogalla. Mustis. Mitchell. Tyson. Gazanfer. Trainier.
Yes.
Gould. Van Dyne.
Yes.
Balich. Brooks. Parker. Ventura. Coleman. Markham. Berkowitz. Pretzel. Weigel. Freeman. Curlitis. Cowan.
22 affirmative, the motion carries.
And my agenda disappeared, so I'm going to go to item number 4, 22-113. And I move to approve the grant fund transfer for Joliet Township.
Motion by Trenier, seconded by Frizalone. Previous roll call by Newquist, seconded by Van Dyne. All in favor? Any opposed? Motion carries.
Thank you very much. That's the end of our agenda. I will see you hopefully at our next meeting, first Tuesday of next month. Have a great afternoon.
County Board Member Van Dyne, Public Works and...
Good afternoon, Madam Executive and everyone in attendance. We have 14 items to consider, all which were voted yes unanimously. Starting with number 1, 22-114, confirming award of contract to K5 Construction Corporation, $1,481,877 for Plainfield Road, County Highway 14, south of 119th Street to 87th, County Board Districts 3, 11, and 13, and I so move.
Second, Freeman.
Motion by Van Dyne, seconded by Trenier. Previous roll call by Cowan, seconded by Freeman. All in favor?
Aye.
Any opposed? Motion carries.
22-115, the same, using MFT funds of $1,525,000. I so move.
Second, Freeman.
Motion by Van Dyne, seconded by Freeman. Mr. Markham, would you like to be a yes? Okay. Previous roll call by Cowan, seconded by Mueller. All in favor? Any opposed? Motion carries.
22-116, confirming award of contract to Austin Tyler Construction, $72,815.75 for Jackson Road District Overlay, County Board Districts 2 and 6, and I'll make the motion.
Motion by Van Dyne, seconded by Gould. Previous roll call by Pretzel, seconded by Trenier. All in favor? Any opposed? Motion carries.
22-117, confirming award of contract to Tri-State Asphalt, $61,004.40 for Florence Road District Materials, County Board District 6, and I so move.
Motion by Van Dyne, seconded by Gould. Previous roll call by Frizalone, seconded by Mitchell. All in favor?
Aye.
Any opposed? Motion carries.
22-118, confirming award of contract to Tri-State Asphalt, $41,072 for Florence Road District Materials, County Board District 6, and I so move.
Motion by Van Dyne, seconded by Gould. Previous roll call by Mitchell, seconded by Mustis. All in favor? Any opposed? Motion carries.
22-119, confirming award of contract to Grosso Trucking, $39,870 for Florence Road District Materials, County Board District 6, and I'll make the motion.
Motion by Van Dyne, seconded by Gould. Previous roll call by Mueller, seconded by Mustis. All in favor? Any opposed? Motion carries.
22-120, authorizing approval of the establishment of altered speed zone, County Board Districts 2 and 12, and I so move.
Motion by Van Dyne, seconded by Mitchell. Previous roll call by Weigel, seconded by Trenier. All in favor? Any opposed? Motion carries.
Number 8, 22-121, authorizing approval of the establishment of altered speed zone, County Board District 13, and I so move.
Second, Freeman.
Motion by Van Dyne, seconded by Freeman. Previous roll call by Brooks, seconded by Newquist. All in favor? Any opposed? Motion carries.
22-122, authorizing approval of the establishment of altered speed zone 600, County Board District 13, and I so move.
Motion by Van Dyne, seconded by Freeman. Previous roll call by Brooks, seconded by Coleman. All in favor? Any opposed? Motion carries.
22-123, rescinding resolution number 15-373 and authorizing approval of an IDOT County Joint Agreement for improvements on Cedar Road, County Highway 4 over Spring Creek, County Board District 7, and I so move.
Motion by Van Dyne, seconded by Frizzalone. Previous roll call by Berkowitz, seconded by Ballage. All in favor? Any opposed? Motion carries.
22-124, authorizing approval of professional services agreement for right-of-way acquisition services for Cedar Road and Francis Road intersection improvements, County Board District number 12, and I so move.
Motion by Van Dyne, seconded by Pretzel. Previous roll call by Weigel, seconded by Ogala. All in favor? Any opposed? Motion carries.
22-125, authorizing approval of professional services agreement for right-of-way acquisition services for the property, Cedar Road and Francis Road intersection improvements, County Board District 12, and I so move.
Motion by Van Dyne, seconded by Pretzel. Previous roll call.
Freeman.
Freeman, seconded by Weigel. All in favor? Any opposed? Motion carries.
22-126, authorizing approval of professional services agreement for the right-of-way acquisition services for several parcels of property on Laraway Road and US Route 52 intersection improvements, County Board Districts 8 and 12, and I make the motion.
Motion by Van Dyne, seconded by Pretzel. Previous roll call by Brooks, seconded by Newquist. All in favor? Any opposed? Motion carries.
Lastly, 22-127, authorizing approval of professional services agreement for the right-of-way acquisition services for several parcels of property for the Laraway Road and US Route 52 intersection improvements, County Board Districts 8 and 12, and I so move.
Motion by Van Dyne, seconded by Pretzel. Previous roll call by Freeman, seconded by Weigel. All in favor? Any opposed? Motion carries.
And the next Public Works and Transportation Committee meeting is scheduled for June 7th, 2022 at 9 a.m. Thank you.
County Board Member Tyson.
Good afternoon, Madam County Exec. Good afternoon, everyone else. In recognition of Pride Month, there will be a flag ceremony in front of the county building on Wednesday, June the 1st at 10 o'clock. So therefore, the next Diversity and Inclusion Committee meeting, which is scheduled for 10 o'clock, will be moved to 10:15.
I just want to make a quick note. It's just going to be the flag rising, so be there on time or you may miss it. We're just putting the flag. If there's no ceremony, there's no, yeah. June 1st.
Wednesday, it's the first Wednesday. If you have it as June 8th, that's incorrect. There was a typo on it. It was a typo, so it's actually June the 1st, Wednesday, June the 1st, the first Wednesday in the month. Thank you.
Thank you. County Board Member Ventura.
Yes, I have the quarterly, I don't have in front of me, regional superintendent's report to file. I did want to highlight a few things in that report. It's a quarterly report. They renewed licenses. They had 654 professional licenses, 345 substitute licenses, 66 paraprofessionals, and then there were 258 bus drivers who either received refresher courses or got their new licenses. There's some other information in the report, so I encourage you to look at it, but I will place that on file. I so move.
Motion by Ventura, seconded by Freeman. Is there previous roll call? By Mueller, seconded by Brooks. All in favor?
Aye.
Any opposed? The motion carries.
22-128, extending Sunny Hill Nursing Home admission policy for non-Will County residents. We did, in committee, move this from 6 months to a year, as it is helping fill our beds, but also still leaving room for Will County residents directly to use our services at Sunny Hill, and I so move.
Motion by Ventura, seconded by Mueller. Previous roll call by Freeman, second by Ogala. All in favor?
Aye.
Any opposed? Motion carries.
And our next Public Health and Safety Committee meeting is scheduled for Tuesday, June 7th at 1 p.m.
Chairman Winfrey is not here. Is that you? County Board Member Coleman.
So there was no meeting this month, but next month it will be on June 14th, 2022 at 9 a.m.
Thank you. County Board Member Brooks.
Good afternoon, Madam Executive. I have no resolution to bring forth. My next meeting is June 8th, 10 a.m. Thank you. God bless you all.
Thank you. Executive Committee, Speaker Cowan.
Thank you very much. I'm going to enjoy speaking at a normal pace. 22-129, establishing the salary for the Will County Sheriff, and I so move.
Motion by Cowan, seconded by Frizzalone. Previous roll call by Freeman, seconded by Balich. All in favor?
Aye.
Any opposed? Motion carries.
22-130, awarding bid for body armor for the Sheriff's Department, and I so move.
Motion by Cowan, seconded by Freeman. Previous roll call by Frizzalone, seconded by Ogala. All in favor?
Aye.
Any opposed? Motion carries.
22-131, authorizing emergency replacement of cooling tower roof at the Will County Adult Detention Facility, and I so move.
Second, Mueller.
Motion by Cowan, seconded by Mueller. Previous roll call by Brooks, seconded by Gonsifer. All in favor? Any opposed? Motion carries. Yes, you're still.
22-132, authorizing contract for demolition located at 3520 South State Street in Lockport, Illinois, and I so move.
Motion by Cowan, seconded by Frizzalone. Previous roll call by Ventura, seconded by Coleman. All in favor?
Aye.
Any opposed? Motion carries.
And this next one, I believe I'll be making a motion to table. Is that correct? Mitch, do you want to? SCS. Okay. Do you want to say anything about that?
Thank you, Speaker Cowan. So I talked about this in Executive Committee too. We just had another call with SCS where we thought we would have a final agreement. We're not quite there. There are three kind of outstanding items that we're working to address with SCS. We left that conversation with, we're going to have another meeting next week. So this is something we're trying to prioritize and move as quickly as we can because we need to get staff on site and trained when the RNG plan is actually finished with the construction and commissioning starts. So,
okay. So I believe we may end up needing to do a special meeting because we won't want to wait until our June county board meeting to pass this. But
correct.
As soon as you get the word, then let us know.
Yes.
All right. Yeah, Mary, would you recommend postponement? Even though we don't have the date of the meeting, but doesn't matter? All right. I would like to make a motion to postpone 22-133 to a meeting of a date and time to be announced.
Second, Mueller.
Motion by Cowan, seconded by Mueller. Previous roll call, Gonsifer, seconded by Frizzalone. All in favor? Any opposed? Motion carries.
22-134, authorizing professional services agreement with SCS Engineers for permitting and contractor procurement services to support the operations of the RNG plant and RNG pipeline, and I so move.
Second, Mueller.
Motion by Cowan, seconded by Mueller. Previous roll call by Moustis, seconded by Freeman. All in favor?
Aye.
Any opposed? Motion carries.
22-135, authorizing professional services agreement with Eco Engineers for Phase 5 of the RNG facility development at Prairie View Landfill, and I so move.
Motion by Cowan, seconded by Ganzifer. Previous roll call by Mueller, seconded by Freeman. All in favor? Aye. Any opposed? Motion carries.
22-136, awarding bid for consulting services for historic preservation plan, and I so move.
Motion by Cowan, seconded by Freeman. Previous roll call by Ganzifer, seconded by Brooks. All in favor? Aye. Any opposed? Motion carries.
And I would like to make a motion to remove from the agenda 22-137.
Motion, Mueller.
Second.
Motion by Cowan, seconded by Mueller. Previous roll call by Ogala, seconded by Ventura. All in favor? Oh. Any opposed? Motion. Any opposed?
No. Oh, yeah, she just had a question about why we were.
That are in the agreement that was brought forward. So we're going to try to clean it up first.
Sorry. I'm like, I don't know where we're at here.
All right, 22-138, authorizing a First Amendment to IGA with the Illinois Housing Development Authority regarding disbursement of ERA 2 funds, and I so move.
Motion by Cowan, seconded by Ventura. Previous roll call by Frizzalone, seconded by Ogala. All in favor?
Aye. Any
opposed? Sorry, guys. Motion.
22-139, declaring various equipment surplus and authorizing disposal, and I so move.
Motion by Cowan, seconded by Trenier. Previous roll call by Markham, seconded by Tyson. Tyson, yeah, thank you. Do you have a question? Okay, Tyson, thank you. All in favor? Any opposed? Motion carries. You can yell out last names. It's even easier. I'm trying to go by voices.
Yeah.
It's really hard. Speaker Cowan.
22-140, declaring vehicles as surplus and authorizing disposal, and I so move.
Motion by Cowan, seconded by Gans first. Previous roll call by Markham, seconded by Tyson. We're going to be 2 in a row. All in favor? Any opposed? Motion carries.
22-141, awarding contract to Bisping Construction for earthwork at the Will County Morgue, and I so move.
Second, Mueller.
Motion by Cowan, seconded by Mueller. Previous roll call by Tyson, seconded by Van Dyne. All in favor? Any opposed? Motion carries.
22-142, awarding contract to Bisping Construction for site utilities at the morgue, and I so move.
Motion by Cowan, seconded by Weigel. Previous roll call by Brooks, seconded by Ogala. All in favor? Any opposed? Motion carries.
22-143, awarding contract to JB Contracting for the site electrical at the Will County Morgue, and I so move.
Second, Mueller.
Motion by Cowan, seconded by Mueller. Previous roll call by Freeman, seconded by Newquist. All in favor?
Aye.
Any opposed? Motion carries.
22-144, awarding contract to Duco Cement Construction for site concrete at the Will County Morgue, and I so move.
Motion by Cowan, seconded by Mueller. Previous roll call by Frizzalone, seconded by Ballage. All in favor?
Aye.
Any opposed? Motion
22-145, awarding contract to Troke McNeil Paving Company for asphalt paving, striping, and signage at the Will County Morgue, and I so move.
Motion by Cowan, seconded by Mueller. Previous roll call by Frizzalone, seconded by Ogala. All in favor?
Aye.
Any opposed? Motion carries.
22-146, awarding contract to Indicom Electric for generators at the Will County Morgue, and I so move.
Second, Mueller.
Motion by Cowan, seconded by Mueller. Previous roll call by Ogala, seconded by Tyson. Sorry, all in favor? Any
Aye.
opposed? Motion carries.
22-147, replacement hire for County Executive Director of Facility Services, and I so move.
Motion by Cowan, seconded by Newquist. Previous roll call by Frizzalone. Oh, question? Hold on 1 second.
Still here today?
He is not.
Oh, okay.
Yeah.
Yeah, if he can come next time so we can meet him, that'd be
Yeah,
great.
he starts June 6th, yes. After this, and then we will. Where are we at here? So we are at a motion second, previous roll call for Zalone, second by Coleman. All in favor?
Aye.
Any opposed? Motion carries.
22-148, replacement hires for Laraway Communication Center, and I so move.
Second, Mueller.
Motion by Cowan, seconded by Mueller. Previous roll call by Frizalone, seconded by Gansifer. All in favor?
Aye.
Any opposed? Motion carries.
22-149, replacement hires for Sunny Hill Nursing Home, and I so move.
Motion by Cowan, seconded by Ogala. Previous roll call by Freeman, seconded by Van Dyne. All in favor?
Aye.
Any opposed? Motion carries.
22-150, replacement hire for DOT road maintainer, and I so move.
Motion by Cowan, seconded by Freeman. Previous roll call by Gansifer, seconded by Tyson. All in favor? Any opposed? Motion carries.
Thank you. Our next executive committee meeting is scheduled for June 9th, 2022 at 10 a.m. I would like to make a motion to accept the county executive's appointments for June.
Motion by Cowan, seconded by Mueller. Previous roll call by Duquist, seconded by Tyson. All in favor? Any opposed? Motion carries. Oh, mine is, yeah, Jackie Trunier is not here. She's absent. Thank you. At this time, are there any public comments relevant to matters under the jurisdiction of the county? Anything at all regarding county issues? We've worn everyone out. County board members, please press your button if you have comments. Remember, they're limited to 3 minutes. All right. And I told you they come in order here. It's great. County board member Ogala.
Thank you. I would like to ask for 12 minutes, please. No, I'm just joking. Just joking. So we've had this conversation on and off for quite some time regarding proclamations and fairness, diversity for all the members of our community. So we hear different proclamations come forward. Proclamations from the majority party make it to the agenda. Proclamations from the minority party do not. We represent everybody, guys. Everybody. We all do. Every one of us. I am more than happy to support issues that are important to you, but I feel that you guys should be more than happy to support issues that are important to our caucus as well. I think that we all know members in our community that support. That's okay. It's okay, Sherry. I'm not thinking you're rude. So I would just like to, as we're going forward, let's do that. Let's have that. Let's give each other the same respect for our points of view as you guys would like us to. Thank you.
Thank you. County board member Freeman.
All right, thank you. We will not be meeting again before Memorial Day, and I would like to encourage everyone to attend an event on May 31st, walk in a parade, help place flags on our fallen heroes' headstones, attend a ceremony, but most importantly, remember the sacrifices that were given for each one of us on that day. If you don't remember them every day, especially remember them that day. Thank you.
Thank you. County board member Ballage.
Yeah, I want to remind all the people that have been here for a long time, and the new people don't know, but we kind of had an unwritten agreement about proclamations that we wouldn't bring forth stuff that the other side finds it is like a social thing that we don't agree with, or we may agree with it, but it's like out of place. Like for me, I look at everybody as a human being. We're all created equal under God, you know, so I look at everybody the same. The other side of the question is the social issue when you start putting people in boxes. So you don't like somebody because they're in a box that says you're this, or a box that says you're that. We're all equal. So I voted yeah because I didn't want to be offensive to the pride stuff. But I think that's a bunch of crap. They're people like we are, you know, and we shouldn't be doing this kind of stuff. So I'll let you know something. If we're going to get social issues, I'll put social issues up that you guys will go nuts. I'll be here every meeting with social issues. And you won't let them be read. So I promise you, I'll get lots of speakers and I'll put on a movie that everyone will love to see. So if you guys want to do it, I'll do it back. I don't know about the rest of my caucus, but I really don't care. I'll do it myself if I have to.
County Board Member Pretzel.
Good morning, thank you. Just want to share one paragraph from an article in the Patch this morning. It says, New Lenox residents are feeling the squeeze at the pump with gas prices at a record high in Illinois. The average price of gas in Illinois was about $4.92 per gallon Wednesday, according to AAA. That's up 13 cents from a week ago and 57 cents from a month ago. In Will County, the average price for a gallon of gas was around 9 cents over the state average on Wednesday at about $5.01 per gallon. Gas prices continue to be a problem for the residents of Will County, yet the county board continues to sit on their hands and not address this issue at all. I've called for a resolution to repeal the Will County motor fuel tax. I understand it may not be popular, but I think it's a shame that it won't even make its way to an agenda so we can have a discussion about it. I'd be open to a holiday. I'd be open to some sort of a pause. But for us to just avoid this altogether is a huge disservice to the residents of Will County, especially the lowest income. Thank you.
Thank you, County Board Member Krolitis.
Thank you, Madam. We recognized May with a few resolutions here today, and I would like to add a few thoughts. May is a very special month because on May 8th, we celebrated Mother's Day. I would like to honor the role, importance, blessing, and incredible value of mothers. As well as being a Will County Board member, I am also the Vice President of Moms for America, a national organization with a network of over 500,000 moms and growing. Our goal is to reclaim our country for truth, family, freedom, and the Constitution. I would like to honor the mothers all across our country, but today, especially to the mothers here in Will County and to the mothers here in the boardroom. Moms, thank you for your love and devotion as you nurture, teach, pray, and guide your children every day. You are appreciated and celebrated. You are the foundation of hope because you are raising the next generation. You are also the heartbeat of your home. And moms, you are amazing. To the mothers here that have carried your child in your womb, or to the mothers that have adopted a child into your heart, I would like to say Happy Mother's Day. You are a blessing, and also Happy Memorial Day.
County Board Member Mitchell.
January 3rd, maybe 4th of 2020, I laid down to take a nap, and I woke up to half my body not being able to function. And I thought I slept wrong, so I went back to sleep. And I woke up, and half my body was not functioning. And at that moment, in the morning, and at that moment I knew that I needed to go to the hospital. I had a stroke. May is National Stroke Month. And I just want to tell everybody here that if you have high blood pressure, do not play with it. It is a silent killer. I had no idea. I was living life, having a great time. And just like that, my life changed. Now today, and people go, oh, was it a mini stroke? Was it a this? No, it was a full stroke. It was on the pons. It was at my brainstem. So had it been worse, I would have been dead. So it is National Stroke Month. They have this little thing, FAST, F-A-S-T. And, sorry, I don't even like, I'm kind of a private person, so I don't even like talking about it, but I think this is important. So F is for face drooping, A is for arm weakness, S is for speech difficulty, and T is time to call 911. I didn't call 911, I didn't even want to go to the emergency room, just letting you know that right now. But, get there as soon as possible. So just one, and maybe next year we'll do something to that, but I just want to take this opportunity to let you know, please take your medication regularly, check your blood pressure regularly, keep your doctor's appointments, don't play with it, it's not a game. And I'm very fortunate to be here today. I'm very fortunate that I did not suffer any major lasting effects. I look normal-ish to you, and I'm very grateful for that. That's it.
County Board Member Ventura.
Yes, I have 4 housekeeping things. The first one is for the housing RFQ. The interview committee was supposed to move forward last summer. I'm going to keep bringing this up at meetings until we move it forward. It's been over a year. We heard in our forest preserve that we don't have enough housing. Surprise, surprise. We've heard just about in every committee. So I think it's time that Will County continue our dedication towards housing and that we move this RFQ forward. My next item is on the adjudication. My understanding is that we were supposed to create some type of committee that would look at this so that we could have some type of solutions with land use in moving forward either some policy. I know we talked about a lot of ideas in executive, so I'm just checking to see where that committee is at, and hopefully we will see some more progress on it very soon. My next one is the cannabis spending. I have asked first to have a committee from the community, and then more recently, a ad hoc committee of our own members, and like Frankie, that request has gone unheard. So I feel you on your pain, Frankie. So just bring that up again, that it's any committee, whether it's finance or executive, perhaps we could start talking about some committee to look at those. The next one is the land use zoning categories. When I was on land use, I brought this up, and we have seen since then multiple cases where I-1 is not it's becoming a dump all for things that don't have an appropriate category. And of course, once we make something on I-1, there are some unintended consequences to that, even though somebody maybe just wants a storage container or a land use site for their landscaping company. So Tyler, I'm asking once again that we look at the policy of what zoning categories we have, because A1 with a special use or C4 with a special use is not cutting it, and we need to have better options. I want to thank all of our staff who helped bring money from tax dollars, from grants, and services that we provide here at the county for mental health, for substance and behavioral health, for food and housing. I know that our staff, both the county board, the county executive, land use, and many nonprofit organizations have worked tirelessly behind closed doors, both on policy, on networking, and helping our residents. And I just want to take the time to say thank you. I also would like to wish everyone a happy Memorial Day. Thanks.
Thank you. All right. County Board Member Mueller? Do you have something? Okay.
Thanks for sticking with us, you guys. I know it's been a long morning. I'm going to be quick. I just wanted to say, when Jess McLevin, the chair of the Will County Pride Coalition, asked me to meet with her to discuss inclusivity in Will, we had some really robust conversations about shortfalls that her community has noticed and what other municipalities and bodies like us are doing to tackle some of those issues. One of the things she brought up was a proclamation in the pride flag. I was really grateful that the county executive was agreeable to that. I realize a flag and a proclamation won't repair any of the problems of inequality that we have in this county or this nation, but I think that small things like this go a really long way in helping a often discriminated against community feel seen and heard. I look forward to talking about any of the discriminated against communities needing to feel seen and heard. I'm always open to those conversations. I also wanted to thank the folks who came today to speak in support of the Rehabilitation Center. I want to thank them for their courage in recovering and supporting folks in recovery and coming here today to share their stories with us. I want them all to know that I see them and I know their struggle, and I'm grateful that they're still here with us. Lastly, I'm going to say, as leaders in our county, it's often up to us to model behaviors, compassionate behaviors. Earlier this month at Public Health and Safety, Dr. Burke came in and spoke with us about stopping the stigma about addiction and how just that step, it's a huge step, just how that step could help so many people who are suffering. So I'm just going to let folks know that I support this facility, and I'll continue to support many more like it, regardless of where they're located in the county. Thanks, guys.
Thank you. County Board Member Frizzalone.
Thank you. Well, everybody took all my comments about Memorial Day and some of the other things. So I'll just have one thing to say is the ECS people, they definitely moved me as well. And so I'm going to start a little county board envelope. Anybody that wants to contribute, I'll start it off with a $250 donation. And over the next month, if anybody wants to put anything in there, and then we'll just give it to Dr. Sharma next month. Thank you. Have a good weekend.
Very nice. Thank you. Speaker Cowan.
Thank you very much. In my mission to remind people not to get charged extra for their health insurance, the next phase of Manage Well is now open as of Wednesday. So Mike Frizzlone is done. Look at that. So if you have the county health insurance, make sure you go fill that, do the second half. I think it's a questionnaire. Early voting open today. Congratulations to the clerk and her staff for getting to this point. I know this starts, it doesn't start, but it is like really starting the next 6 months of activity. So everybody go vote. That's all I have. Have a great day.
Wonderful. Okay, we have no executive session today. I need a motion to adjourn. Motion by Markham, seconded by Brooks. We are all in favor. Any opposed? We are now adjourned until June 16th, 2020.